Good morning, Dora and Carrie. I can see you guys have joined. We are going to mute ourselves and say hi as everyone joins and then get started. Right about 7:55, I'll say good morning and hello to everyone. Good morning, Joni. I can see that you've joined us. We are waiting for our students to join and we will go ahead and get started at 8 a.m. Good morning, Kate. I see you've joined us as well, and I've let Dora and Carrie know that I'm going to go ahead and mute, say good morning as you guys join, but we'll get started for our class at about 7:50. Good morning, Sarah. I am going to go ahead and mute everyone until we go ahead and get started about 7:55. You'll hear me saying good morning to everyone as they join. Good morning, Stacy. I have everybody muted right now. We'll go ahead and get started at about 7:55, but you should hear me saying good morning to everyone as they join. Good morning, Allison. We are just going to get started in about 1 minute. I'm hooking up my camera now, and then we'll wait for our speaker. I do just want to say, though, thank you everyone for joining. And I know this is an early Saturday morning, but hopefully we can get back into the swing of things. As a reminder, if you need to leave the meeting, step away from the meeting or anything like that, you absolutely can. Please make sure, though, that you are only doing so because it is necessary. We do have a few students that will not be joining us today because they are essential employees and are working at grocery stores. So hopefully we can get them caught up to speed as quickly as possible. But again, the more you miss, the harder it is to catch up. So if you can take your phone with you, if you connect that way, wherever you are leading to, that would be great if you're able to continue to listen in. However, if you miss any information, please let me know so that I can get you that information. And then I'm going to get my video hooked up. Good to go.
Can I mention something?
Although it is a super unflattering angle, I guess I have my video hooked up now. I'm going to go ahead and unmute everyone just really quickly so we can all say good morning. If you guys have any questions during the chat today or during the presentations today, and you do not want to interrupt the speaker, you do not want to ask them yourself, it is totally okay. Please just send them through the chat and I'll ask them for you. And I believe we are all unmuted.
Hi.
Hello, good morning.
Good morning.
Okay. So I am going to do a few housekeepings before we have our speaker join us, because we should have, and she's attempting to join right now. So we first have Elaine Brown joining us from Sierra Regional Center. For homework and stuff this afternoon, I'm going to try and make my piece in the afternoon as quickly as possible, because I know you guys are dedicating your entire Saturday to me today, and I appreciate that. So please note that if you miss anything, again, send me an email or let me know that you have missed a section so that I can get that information to you. Most, if not all, of our presenters sent me their information yesterday. So I'll be emailing out all of the presenters' materials to you guys after the class today. As for Dora or anybody else who needs an accessible version of this, please let me know. And we will be getting that to you as we're working through them this weekend. We should have those to you by Monday. And then for your homework from last class, please email me a copy of that or text me a picture of that. You had to research a school, and it could have been any school from early intervention through college that provides any sort of disability benefits or disability programs, and provide me information on that. So there was 3 questions you guys had to answer. Please email me the answers to that, or text me a picture of that. If you'd like to verbally provide me the answers to that, you can do that as well. We can communicate on the side. So I don't want to waste any time from our presenters today. We have Elaine Brown joining us. Elaine, can you hear me?
Yes. Hi, everyone.
Hi.
So, and then I am going to go ahead and mute everyone else but Elaine. So if you guys, again, have any questions, remind yourself to unmute yourself, or you can send it through the chat, and we can ask them for you.
Okay, so give me a second and I will share my screen with you. But at first, I wanted to see maybe we can do some introductions And I see a few names, maybe a couple faces. Can everyone hear me okay?
Since they're muted, I'm assuming so. If anybody has
Okay.
any issues, please send them through the chat. Okay, everyone's saying
Okay.
yes, they can hear you.
Perfect, perfect. All right.
Except for Dora. We do have one student that's saying she's not able to hear you. Are you able to get closer to the microphone?
Yep. All right. And is volume maybe way up? Can you hear okay?
Dora, how's that working for you? Yes, good.
Good. Okay. Thank you. All right. So I'm Dr. Elaine Brown, and I work as the Chief Psychologist for State of Nevada Aging and Disability Services Division for Developmental Services. And I'm really, really thrilled to be able to talk with you today. I do want you to know that I could spend an entire semester talking about developmental disabilities. So I tried to really focus on just content areas that probably throughout this program that you're participating in, hopefully you have covered or you're going to cover it in some detail. But I just wanted to talk today and present sort of my current thinking and work within the field of intellectual and developmental disabilities. I have worked for the state of Nevada for 20 years, and intellectual and developmental disability has been my field as a psychologist, even at a predoctoral level at Ohio State. And at that program, it was housed in the University School of Medicine at Ohio State. It was a university center for excellence, much like University of Nevada, Reno has a center of excellence for disabilities. So those have been around for quite some time, with an emphasis on training and leadership in the field of intellectual and developmental disabilities. So I was very glad to find myself there to start my career as a psychologist in this field. Over the years, I've become increasingly interested but also just realized the importance of how the research and policy and practice all fit together, and to really improve the lives for people with disabilities. There has to be this effort at all levels to try to support people in lives of dignity and meaning in our communities. So I'm thrilled to bring to you today a bit of how I see our work in the field of intellectual disabilities within a state system and government system. So let me go ahead and see if I can get this screen up. Okay. So what I have today.
Elaine,
Yeah.
this is Catherine. I just want to also remind you, we have a student that is visually impaired. If you have any pictures on your screen, please provide some visual descriptors.
I will describe. Yes, thank you. Okay, so I can go ahead. Let me see if I can. Okay, so what do you all see? Well, can you, some of you see the screen, my screen, and can you see me? Or do you just see my screen?
We currently just see your screen.
Just the screen.
Does everyone else see Elaine?
I see both.
Screen? Okay, perfect.
Do you see both? Okay, okay. I'd like you to, I don't know, not that I want you to see me, but, but I think it sometimes helps. I'm just going to try to converse through the content more than have you have to read or see anything. So, all right. I had 3 objectives today. One was to just describe to you important topics in intellectual and developmental disabilities. And these really come from my view in working in this field, what I see happening globally at a federal level, state, local level. What is important? Where are we going? Where are we headed? What is our mission? And then I wanted to also talk about developmental disability services. What does that mean? What does service mean? What does that mean for people who enter into a formal service delivery system through our state government, through local governments? And then the third objective I had was, what does it mean to support needs related to community life? If we're really talking about what do people need? What do all people need? How do we go about doing that? What is important? What are we finding that's really going to have meaning for the lives of people in our communities and people with disabilities? I looked at some of the content for the Partners in Policymaking. Oh, I put Partners in Policymaking and the curriculum. And I noticed just some of the content around that you talk about in the program, the future of disabilities, people first, person-centered thinking, family supports for living, and government, policy, legislation, and process. So those are all things that within a matter of 30 minutes, I will kind of touch on, because I really can't separate them. They all go together in the work that we do day to day. So some of the important topics, and I would imagine that you've already talked about this and covered some of this in your program or in other aspects of your work and vocation or education. But really, I think what drives the thinking right now and where we come from is a place of person-centered thinking. What I find is we can often use those words and not have a lot of meaning behind them. But if you truly embrace person-centered thinking and person-centered planning, you're really able to answer essential questions. Who is the person? What is important to him or her? What is important to versus what is important for? And if I were to have someone in my life who came to me and said, hey, Dr. Brown, I'm going to work with you in your person-centered plan. My response to that would be, do you even know me? And how is it that you would know me? So I think that is really, these questions are really hard. So it has to be driven by, if you're going to support me, you're going to know who I am. You're going to know what's important to me. And I will consider and take into consideration what's important for, because it's based on who I am. Person-centered thinking, and if I am engaged in a practice of support and working with people and working with my coworkers and my family, if I am truly taking that position, it is a tough one to take, because continuously what happens is I come about it from my perspective. This is what's important for people. This is what people need. I want to help people. And to have to take a step back and say, what do I know? What do I not know? And to truly be engaging with people in a manner that is continuously embracing person-centered thinking is work and takes some practice. So what's important to and what's important for? The materials that I provided to you will have a couple links to videos, and I'm not going to show them today. But I want you, why they're there is important. The first one is just an introduction with Michael Small, who's one of the founders and leaders around the movement around person-centered thinking. And the second one is a quality of life. It's a trailer, actually. It's about 12 or 3 minutes long. It's a trailer of a documentary done by a young man who took the story of his aunt's life. And she was largely raised in institutions until her family decided to, and by institutions, I mean group home, until her family decided to take her home. It's a really, I found a really touching documentary because it, to the extent that it highlights what you have in your life and what you can have in your life that brings meaning and quality to it. So in the work of intellectual and developmental disabilities, I think that the person-centered thinking and the focus on quality of life is the foundation of the work. And this is a quote that was actually, I borrowed this from another presentation done through the University of Minnesota Institute of Community Integration. So a father about his 9-year-old daughter says, you know, my dreams for Margaret are no different than those from our other children. I hope that someday she may be a friend, wife, mother, colleague, taxpayer, anything but a client. When we are supporting people and families and able to view that what we're talking about is creating life of meanings, I think it's really important. And I'll talk a little bit more when I talk about service delivery and being in services and what does that mean? I don't know that people, for my children, I don't have a child and think, boy, I really wish I had a case manager someday. It's about what do I need as a family, as a wife, as a mother, and how are we supporting each other? So I like that quote. There's also, you can think of the definitions that we have even around disability, and I'll talk a little bit about language. So if I take a global perspective around disability, it's a very broad umbrella term. It's a global term. It's not a health problem. It's a complex phenomenon. So you have the interaction between yourself, your person, and the features of the society in which you live. So I, as a person, and my physicality, what does that mean in terms of my access to what I need day to day? What does that mean for my vocation, my education, and my basic health needs? So it's complex, meaning it's maybe limitations, restrictions, impairments. But people with disabilities have the same health need as others. So it is not a health problem. It is the complexity of what are the barriers that I might experience in meeting the demands in my society in day-to-day life. So in our federal level, we have a federal definition of developmental disability. And this definition has been adopted in 2000. So not just disability, which is a part of our just life, but a developmental disability is really when we're talking about what arises during a developmental period. So prior to age 22, and it's severe and chronic, meaning that this disability, this condition may present barriers for an individual throughout their life. And the federal definition, just like a global definition, is going to be very broad. So it just says it's due to mental or physical impairments. But what it does is it's that physical aspects of us that result in limitations in life areas, major life areas: self-care, language, learning, mobility, economic self-sufficiency. So it means that there's limits that I am experiencing so that I can and am in need of support and being able to access and participate in my community life in a meaningful way through those supports. So there's definitions of disability. There are also how we think about disabilities. Do we view disabilities from a perspective of a person in need, of a person who is vulnerable, a person who has some type of difference? Or do we think about disabilities in terms of what it means for all people to have dignity, respect, and be valued members? There's also a link in your materials to a little video, which is an educational video. It's very short. It's one I use in training law enforcement officers on just what is disability. And it's an introduction really to treating people who have various disabilities just as you and I would be treated. And I think it's been several years since the video was put out, and I think it's been fairly useful as a way to get people thinking about disabilities. So one of the efforts, I'd say, over the last decade to try to promote that people have a right to live, love, work, and play in their communities and have life aspirations just as everyone has been efforts through the National Association of State Directors, which is a national organization, and at a federal level, Administration on Community Living. So our federal organizations, as you know, will often partner with various states, nonprofits, universities. And this is actually an effort which also has been worked on through Human Services Research Institute, University of Kansas. And essentially, it's, if we're truly looking at our support and systems across our states and in our communities to really guide people in positive life trajectories, what does that look like? How do we create for people meaningful days? When you really look at people who are thriving and personally feel as if I am thriving, and I know that to me, this conversation is especially relevant now, given what we're experiencing. It's something we've never experienced in our lifetime, and a global pandemic, which can shift how we feel, how we think, what we're experiencing, and sometimes at a tragic level. This is really an emphasis on what are the principles that really support our positive life trajectories for all people. How do we do this? How do we create meaningful days in the lives of all people? And essentially recognizing that disability is a part of our human condition. It is not something that is very exceptional. It is typical. So if we look at just our country and having 5 million people who have developmental disabilities, what does their life look like? How does that look like compared to people who do not have disabilities? We want to focus on all people, period, all children, all adults, all of us who are aging. What does that look like? And what does that look like through our lifespan? So that we have a trajectory and we don't get off that trajectory, that each day is a meaningful day, is a life of dignity. So one of the things in the materials that's referenced is only about 25% of people who have developmental disabilities in our nation receive state support, 25%. And in Nevada, it's lower than that. It's significantly lower than that. So what is the life experience for people out there who do not have necessarily formal support, but are supported through their communities, supported by their families? What does their life look like? And are we truly focusing on all people experiencing what they value and meaningful days in their life? So a focus for this effort is to take certain states and over a 5 to 10 year period, look at what are these supports for people and how are they integrated. So for people who have disabilities, and even for those who do not, what we can identify are things that really help us with, if I were to say, what is a good life? What is a meaningful day for me? What am I integrating? And one of those areas is technology, which we're doing right now, and the extent to people access it. It's a huge support in our day-to-day lives now in our society. What are the personal strengths and assets that I bring to the table? How are those integrated? My relationships with people, my family, friends, and community. What are the supports that are community-based? And we're seeing that now in our circumstances. What is there for my health? What is there for my recreation, my transportation, my schools and my education? What is there for me and for all in our community? And then you also have another aspect of support, which is eligibility specific. And what I want people to realize is this is a small piece, not a small piece, it's a significant piece, but it's a piece of what is integrated support for people. So eligibility specific might mean the state developmental disability services system. It might mean the other types of community supports that I access if I have a need, if I am eligible. So special housing, vocational rehabilitation, Medicaid, these other services. I think increasingly what's recognized is in order for people to really truly experience meaningful days and lives of dignity, there has to be attention paid to the strength of all of these areas. So that when you're talking about eligibility specific types of services and supports, they're going to fall flat if they are not considering and taking into account all those other areas that are built up and part of a person's life. So that leads me to talking more about eligibility specific. What does that mean to be a part of developmental disability services in Nevada? So for Nevada, the umbrella organization and government organization that is responsible for a number of our human services in that area is going to be our Department of Health and Human Services. And there are 6 divisions under Department of Health and Human Services. They are Division of Healthcare, Finance, and Policy. That's where Medicaid will be housed. Aging and Disability Services Division. That's going to be developmental disabilities as well as physical disabilities, aging. It will also, another program under will involve children, such as Nevada Early Intervention Services and Autism Treatment Assistance Program. So aging and disability services. There's also Division of Child and Family Services. That is primarily the government division, which is responsible for welfare of children, is their focus. Division of Public and Behavioral Health, our health and our public health system. Division of Welfare and Supportive Services, and Public Defender. So our government is organized with a Department of Health and Human Services with those 6 divisions. So your developmental disability services is going to be housed under aging. That's really consistent with how the restructuring of the federal government over the last 10 years and the administration on community living, because of the belief that over the next 10, 20, 50 years and farther, there has to be a focus on supporting people in their communities. And it's long-term support. So it's not temporary, but it is if I am aging and I need various supports as things change and my circumstances change in life. What do those supports look like? They can be limited, they can be time limited, they can be more extensive, but they're probably considered long-term, not a 3 or 6 month support need. For disability, you're talking about lifespan. What supports might be there in a lifespan? But the goal is for me to have meaningful days and a life of dignity in my community. So for developmental services in our state, we look to the mission, which is part of that division. Nevadans, regardless of age or ability, will enjoy a meaningful life led with dignity and self-determination. That's the vision. So for ADSD, the mission is going to be what are the supports and services to meet the needs. And the philosophy is going to be we have accessibility, accountability, culturally and linguistically appropriate services, ethics, mutual respect, timeliness, and transparency. So it really is about what is there so people lead the lives that they want with dignity and self-determination. So for developmental services in our state, there is specific supports that are identified for people. Again, it's eligibility based. So people who are identified as having an intellectual disability or a developmental disability. The state has a definition of developmental disability, and it's very close to the federal definition. Something back, maybe. I will point out that the difference for developmental disability in for long-term services and supports is that if you look at the federal definition, it will refer to mental and physical disability. For our state, our definition of developmental disability will include any type of neurological condition, cerebral palsy, autism, genetic conditions, but it does not include conditions that are solely physical. It can include traumatic brain injury, but it won't include things that are not neurologically based. So that is a difference. It also, if limitations are due primarily to mental health conditions, then those services are provided under our Division of Public and Behavioral Health rather than developmental disability services. Oops. So we are organized as a program geographically. So developmental services across our state. Yeah.
We have a few questions in the chat, and I just wanted to stop you before we got too far past the time.
Yeah, thank you, because I can't see the chat. Okay.
That's okay. Some of them are sending private.
Oh, okay.
And some are for everyone. So one of them on this topic is, with all the coordination that ADSD does, why do you say that Nevada has a low assistance for people with developmental disability?
Oh, that is a really good question. I think it remains a question, and it's something that we continue to discuss within our state. There's a couple of reasons for it. One of them can be a positive explanation would be that people aren't seeing the need for participating in state services. They are supported through their communities, families, employment, vocation. They just simply may not say, I just don't need to belong to a developmental service system. That can be one explanation. Another explanation, though, is the developmental service system really providing? What are those services? Are they really providing what people need and what would contribute to their meaningful day? Or is it that I'm not going to participate in those services because they're not contributing to the quality of my life? Another consideration might be that people just don't know. They do not know that they are eligible, that they are able to access those services. So there's a number of reasons, and that's a very complex explanation. That's a complex question, but I think it is worth very much considering, especially at this time in our circumstances. Why? Because we definitely are lower compared to many other states in terms of who is enrolled in developmental services. Yeah, it's a good question.
Great. And then the second question was, do you tell people that you serve about ABLE accounts?
Absolutely. Absolutely. Yes. That is, I'll talk a little bit later about some of the highlights I've seen over the last decade, and that is one of them. Absolutely. And promoting that for people.
Okay, and then question number 3 is on the topic of subminimum wage. Will you be discussing that now, or I mean later on, or would you like that question now?
Let's hold that till I talk about the needs for employment.
Perfect.
Okay. All right. Perfect. Okay. So I was just talking about our statewide developmental service system located in 3 geographical regions. Desert Regional Center is Clark County. Rural Regional Center is all of rural Nevada, north and south. And Sierra Regional Center is the hub for the services in Washoe County. Across the state, all of the services are the same. All of the eligibility criteria are the same. We just operate out of 3 main geographical regions. So what are the services? I'm losing my hearing here. The services that are provided, and this is where I think there needs to be some attention paid to for communities and states. What is it that the state is actually doing as a support? Is it what people want? Is it important to them? So the services, which one is a absolutely essential service, is service coordination. There are about 4,500 people, or no, I'm gonna say probably closer to 6,000 now enrolled in developmental services across our state. I wanna say about 1,500 in Washoe County. Every person enrolled in developmental services will have a service coordinator. It is the primary service that is there for everyone. There's absolutely no wait list for it. It is your service coordinator is that person and that contact that engages in that person-centered planning with the team and the family and the individual. Then there are a number of supported living arrangements. The supported living arrangements is how we refer to just support in daily life. So that is everything from someone going into someone's apartment once a week to support them with budgeting or shopping, to someone who's living with maybe 1 or 2 other people and they have support 24/7. Another service is jobs. These are services through community providers. So everything from the jobs and day training programs, which is where we see the subminimum wage, to support around competitive employment, an expansion of what people may receive through vocational rehabilitation. That's another big effort, which I'll talk about, is to really, really support our vocational and rehabilitation services in having people employed meaningfully. And there's family support, which it will include, and these services will often require a financial eligibility for families that are in terms of respite. A family preservation program is a stipend program to support people in their homes. And then there's other types of, I would say, supports within your developmental service system that help all of those services exist. And so our whole quality assurance aspects, we have hundreds of providers in our state that contract with us in developmental services. So we have to oversee what is the quality and also aspects of building capacity in our community. That's quality assurance. We also have nursing, and this is throughout our state. So within our state system, we have some medical and nursing support. And again, it contributes to what is the experience of that individual. We don't do the healthcare directly for people, but we have professionals in our system that can look at from a technical assistance perspective, a support perspective. And that's also true for our psychological services. I have a team here in Washoe County of 6. And we provide support across the lifespan for people who have developmental disabilities in our services, but also just the community in general. How do we go about building what people want in their lives? And so there are various units within developmental services that help support that system. And I mentioned that for our state, our developmental disability examples are intellectual disability and other neurological conditions. I can't emphasize enough that there continue to be myths in our state that you have to have an intellectual disability to receive services, or I'll hear the term like lower IQ. And so I understand why people think that, but there's no cutoff for anything around developmental services. A lot of people who come into our services who have autism or cerebral palsy or other disabilities do not have an intellectual disability. And it's really difficult, though, to try to change that myth that exists. I want to highlight that most children and adults who have intellectual developmental disabilities live with their family. And if you think about that, and think about that from what possibly might be support needs for people, most adults with intellectual and developmental disabilities, where we're at right now in our country, live with their family. It's about 70%. It is true that across our country, most people are not enrolled in state developmental services. So how is it that we as a community attend to and pay attention to the quality of life of all people? So what are those support needs? If people, it was a really good question of why aren't people enrolled in state services? Well, maybe those support needs for their community life and their meaningful life are met. So what are they? I think one of the first that we see in communities is a need for dignity, respect, and rights. When people's rights are upheld, when people are treated with dignity and valued members of their community. When I do trainings for new professionals and service coordinators, there's a reference to a TED Talk that I like that's done by Becky Curran. And she is a motivational speaker, and she's spent a number of years in the entertainment industry, and now has started a business, a nonprofit that focuses on the representation of people with disabilities in the media and really advocating that people with disabilities represent themselves. So Becky is a little person, and what I appreciate about her message that she communicates. And one of the things that really struck me in hearing her talk was she says throughout her life, she's gotten the question of, you know, if you could, would you change? Would you not have a disability? Would you not be a little person? And her response to that is, I never want to change, but I want the way the outside world reacts to my difference to change. And I love that message. It's not me, it's how the world reacts to me. That's what I want to be different. And that's where it gets to look at me and treat me with dignity and respect. I've had the opportunity to talk a few times for a program, the Nevada Dual Sensory Impairment Project, and at their family conference. And this is a program through UNR, and they support families and children who have very severe disabilities and often dual sensory impairments. So they might have vision impairments, hearing impairments, other sensory impairments. And one of the things I do when I talk with those families, they've had me come and talk twice about happiness. Because one of the things that families experience is people viewing them as, wow, you are experiencing such difficulty. They experience a lot of pity, a lot of, wow, this must be so difficult for you. And what families will miss is sharing the joy that they have in raising our son and daughter as they would any son and daughter. There's joy and there is also challenge. And so to be able to realize that you own your happiness, that there will be those in your life who will share it with you, but you own your happiness. Your son or daughter who has a severe disability has their happy. And what you want and what you hope is it's the world sees that as well and experiences that joy with you. So I really like, I like Becky's message when she talks about how is our society and how is it that we are viewing people who have disabilities. Another aspect then of rights that's really important is, you know, there's rights that are the advocacy and the those who can really motivate about how we think about disabilities. But we also know that rights are also legislated. And there's been a few, several rulings and Supreme Court rulings which help to uphold the rights for people with disabilities. One of the things I like to point out is that whenever we have a significant shift, such as ADA or other very significant legal rulings that set precedent in our country, it often takes a decade, 1 decade, 2 decades to see those rulings enforced and to see significant changes and to see their interpretation. So in 1999 was a very significant ruling from the Supreme Court, which held that unjustified segregation of persons with disabilities constitutes discrimination in violation of Title II of the Americans with Disabilities Act. What it meant at that time, and a very significant point in time for our history in our country, is it meant that public entities must provide community-based services to persons with disabilities. And there are some conditions so that the services have to be appropriate. But this truly was a way to communicate. You cannot continue to have your state systems that are supposed to be service-based and community-based. You cannot continue to segregate persons with disabilities. And it doesn't just mean don't have people in institutions. It means you have to take a look at what their community life is and what it looks like. And so in the last 5 years, we have our Centers for Medicaid, Medicare, CMS, has also come out with clarification. So I said it sometimes takes decades. This one takes maybe almost 1.5 decades. Their clarification is what's called the community settings rule. And that means that if I'm going to provide and use federal and state money to provide a service for people with disabilities, it has to be part of a community setting. And they have criteria for what it looks like. And community settings is what is our community? I access the community. What does that mean for me? It would mean the same thing for a person with a disability. So oftentimes with these rulings, what happens is it takes 10 years for them to say, okay, it's not enough. So now we come out with clarification, and our community settings rule is very significant. And I'll talk a little more about that when I talk about the minimum wage. Then at a state level, there are several, I would say over the last 2 legislative sessions, there have been several laws statutes which have really contributed to protecting the rights for people with disabilities. Someone mentioned the ABLE Act, and yes, it started federally, but states have to adopt it. That was very significant. This last legislative session, there was supported decision-making was identified. We became, I think, the 5th state to acknowledge supported decision-making as an alternative to guardianship in our statute. There was also AB 129, which required law enforcement and first responders to receive training in developmental disabilities, following the course of several states in our country. One nice thing, at least in Washoe County, and I also think throughout our state, I've been doing training for law enforcement for 15 years. It's been a part of what people have felt in our community to be important. So to make it law, I think just highlights that it's essential, so it won't go away, and that's thrilled. But we're not like some other states where it really was prompted by serious tragedy. For our state, it's about, look, we need to make this essential. It has to be a part of recognizing the value of people with disabilities in our communities, and that yes, we have to attend to what those gaps might be in supporting people through the work of our law enforcement first responders. So those were pretty exciting. The other aspect of rights and protections, I think, is through our adult protective services. I didn't put that in your materials, but that is definitely something. Nevada was one of the last states to recognize adult protective services, not just for aging, but for vulnerable persons, which includes persons with disabilities. So we have only had those statutes for the last 2 legislative sessions. The expansion of our elder services to also adult protective services. And that's really important. Another consideration is language. Yeah.
I just want to remind you we have about 15 minutes left.
Oh, great. Thank you. Okay. And yes, keep your questions coming in the chat box or however you guys are doing it. I wish I could see it or hear you. Words matter. And we have tried to legislate this at a federal and state level, but we can't eliminate and change all the words through legislation. But one of the things that I really attend to, and I think is hugely important, is continuously looking at how we promote dignity, respect, and value through our language. This is actually something I work with our service coordinators on, that we begin to shift and say and talk about people and not clients. Our state of Nevada does not have group homes. That's not part of our language. We don't even need a technical definition in our supported living services as having group homes. But yet I hear people talk about placement and group homes. And, you know, for me as an adult, when I go to move, I'm not having people place me. And I don't talk with my children about, hey, you know, someday do you want to be a client and have someone place you in, you know, a job or group home? We really need to be focused on how we're using our language in a way that is promoting what we are intending to do. And that is, people need places to live. We need and we want employment and support. I'm supported in my life just as, you know, with or without disability. And so language to me is extremely important. Okay, another support need, health. There,
On the topic of bills, we have a question. What bills are you hoping to see take place in the future in regards to people that your agency serves?
Oh, can you repeat that?
The question was, what bills or laws are you hoping to see take place in the future in regards to the people your agency serves?
Oh, that's a really good question. And I'm a government employee, so I have to be neutral, but that's a hard one for me to answer. But I can give a couple ideas. Some of them have to do with maybe expanding some of the emphasis on rights. Under our work of adult protective services, there really is a Bill of Rights, and some of it isn't so much that the legislation needs to change as much as the implementation and the policy around it. So some of the changes, I think we've done a nice job laying the foundation for our services. I think what needs to happen is really looking at the service array. Are we really getting people what they want and looking at that? And are we really upholding in our policy and practices the rights that are laid out for people? That's what I'd like to see. So that's a good question. Okay, healthcare is essential. And what we also need to work on is not, again, specialized services for people with disabilities, but that people with disabilities are accessing and able to access quality health care. It was really in about 2000, so we're looking at 2 decades now, where it was first really identified that there's a huge gap, and that gap continues, that people with disabilities and their access to health care. So there are different programs through different universities, and if you wanted to do some digging, because that's an area of interest of you, what's really nice is that oftentimes these universities will create very wonderful services or resources for communities. We just have to embrace them. So in your materials as an example, for example, of Ohio State, how do you gear information and public health information to promote health for people with disabilities? Behavioral health is another really important part of our healthcare system. And what we have to do is identify how do we embed it within our developmental service system, and then how do we really build the capacity in our communities to support people with disabilities in meeting their behavioral health needs. A couple things, I only have a couple minutes, so a couple things I want to highlight are that we do have an over-reliance. We continue to over-rely on treating people through the use of medications and not other types of behavioral mental health approaches. There continue to be efforts to look at co-occurring disorders. Oftentimes people have multiple health concerns, not just physical, but also with their emotional well-being. And we have to continue to get better ways to look at those. Another really important area of effort and focus in our country needs to be around sexual and domestic violence for people with disabilities. This is from, one of the materials is a reference to Nevada Coalition to End Domestic and Sexual Violence. And I've been really thrilled with their efforts over the last 2 years to have an advisory committee to prevent sexual abuse of people with developmental disabilities. And again, this is coming out of federal funding and state funding, recognizing that this is a severe need in our family, or in our communities and families. Another support need is education and vocation. So real quick, I am thrilled that there have been efforts over the last 10 years of such as the Workforce Innovation Opportunity Act. There continues to be a lot of debate around the sub-minimum wage. I think that what the focus should be on is, what are our alternatives? How do we have people competitively employed in our communities? And vocation, we have a long ways to go. Another area which we see increasing is our, and which is wonderful, is our post-secondary education. So through UNLV, through UNR, Path to Independence, there are programs that allow people who have disabilities to really participate in secondary education, and that becomes a meaningful part of their life in pursuit of vocation. So the last thing I'm going to emphasize, and it's in your materials and you can refer to them, is the advocacy organizations and community. We have got to continue to use advocacy and family advocacy in order to maintain what is currently there around rights for people with disabilities and supports, but also to continue to make things happen. I've become just increasingly aware of this. There has to be, as things in some ways become more decentralized, you know, we have to use our technology, and we have to use other ways that we come together. And that's what we see now. Instead of a classroom, we have to kind of sit but come together on our computers. So the advocacy, the organizations, and the community, just what you are all participating in, is essential in continuing to build lives of meaning for people with disabilities. Okay, any last questions from you all?
Yes, so we have several questions on the topic of COVID. What are you doing to help people with IDD? And then the second half of it is, can you touch on medical discrimination against those with disabilities? Because some believe that COVID may worsen the discrimination and such.
Yes, absolutely. One of the first things we did as a state, our psychological services team created some one-page descriptions of how we are here for you. So throughout our entire state, all of our providers are aware. If you are experiencing any difficulties, here's how to reach out to us as clinicians. And there's been a huge effort. I'm very, very proud of Aging Disability Services. A lot of the federal money that's coming right now to support vulnerable populations like aging is also available for people with disabilities. So if you go on to, and I'll send you the link, Catherine, to send out, it's Nevada 211 has a special link for aging, but you can also access it for disabilities. And they're able to provide a direct feed to resources. You tell people what you're in need of and they hook you up. So it's really, really nice. There's been a few articles like from the New York Times and others sort of highlighting and making communities aware of, you better be paying attention to people with disabilities and their voice. But some of the barriers that they have to do with their community living. And we see that. More vulnerable living in aggregate settings and not having the opportunities for the medical assistance that's needed. So, and what was the other question? Was medical.
Medical discrimination.
Yes, yes. There are some really nice documentaries, I think, on, or personal stories on YouTube posted about medical discrimination and disabilities. We see this quite a bit for women with physical disabilities like cerebral palsy and raising children and healthcare and how they're treated by the medical community. Again, I think there's a lot of need of public awareness. there is a huge need to recognize that you start first with healthcare. You start with basic healthcare, and then you go from there in terms of what specialties are. I have 4 siblings who have Down syndrome, and they are in their 30s. And 25 years ago, when my parents tried to get them pediatric care, they would say, you know, I have a 10-year-old daughter and she has Down syndrome, and they're like, we don't see kids who have Down syndrome. And that's in my lifetime. So she finally just stopped saying they had Down syndrome, just showed up. So they could get care. But we have a ways to go when it comes to, again, the value, dignity, and respect, and how we're perceiving people who have disabilities in our community and within our medical community.
Elaine, this is Carrie. Hi. So what I wanted to ask specifically about medical discrimination against people who have disabilities is, how does, like, your aging and disabilities, got your name of your agency wrong.
Yes,
already.
yes, no.
Does your agency, because you guys are on campus and there's a medical school and a nursing program, do you guys actually help educate the clinicians?
Yes. For example, a small part of what's done is through the psychiatry residency program. Typically, one of their content areas now is developmental disabilities. So we can go and do it like a didactic lecture. So there really are some nice activities happening. But when you look at our community, our medical community as a whole culture, there's a lot of work to do.
Yeah, it's lacking. And so then when I was thinking about the COVID stuff, and I've read some things, like some articles about people who have disabilities just like not getting hip repaired because they're like, well, you're in a wheelchair, and you're like, it still impacts you. But would they be discriminated against? Maybe not, because they would be deemed as having underlying health issues, even though a disability isn't necessarily a health impairment, and not receive because resources are limited. Would they be like, well, you're not as, their value is placed differently? Have you,
yes.
Do you guys, I don't know, in this crazy time, but do you guys
I've seen a few articles about it. There's been some pretty direct statements that have been written and letters issued to say you had better not be selecting who receives a ventilator based on disability. Right. Very much so. And I think more than at any time I can remember, I have seen more highly recognized media that is acknowledging pay attention, and I think that's a good thing. Okay. So the advocacy is out there. It needs to continue, definitely.
Well, thank you for your time.
Great questions, everyone. And in light of time, I have one last question, and then we'll connect with you via email for any other questions.
Perfect.
This one is on the topic of your group home. I know you said that technically we don't have group homes, but how are quote unquote group homes being held accountable under your contract for services?
Yeah, a lot of that's a really great question. It has to do with how we go about certifying our supported living and making sure that what the requirements are and what their life looks like is meaningful day. So if I have someone who lives with maybe another person or 2 or 3 people, and they have shift staff environments, what do those environments look like? Does it look like a home? Does it look like people are making their choices their own choices day to day? Does everyone have their own schedules and what's important to them? So it really is about looking at, we're not creating small mini institutions in our community, but we have to continue to look at what is the experience for people. Does it look like they live in an institution? Does it look like they live in a home? And that's where our QA and other support services come in.
Great. Thank you so much, Elaine. And then I do have some questions on the sub-minimum wage topic, but in light of time, since we do have our other speakers starting at 9 and we're a few minutes late, I'm going to send you a direct email with that student connected to it so we can get them answered for her.
Absolutely. Thank you so much, everyone.
Thank you, Elaine, for your time. We appreciate you being here.
Thank you. Have a good day. Bye.
Okay, everyone. So we do, up next, we have a presentation by Washoe County DCFS, and I want them to go ahead and introduce themselves. But please remember to keep sending your questions through the chat or interrupt to ask them. And I understand we can't get to every question that's being asked, but we will do our best to do so. And I believe we have both Jennifer on here and Abby. Abby, I believe you said you were going to go first. Is that correct?
Yes.
Great. Abby, if you want to introduce yourself, and then you have full ability to share your screen as needed.
All right, perfect. Hi, everyone. My name is Abby Battalato. I'm a coordinator for Human Services Agency, and I oversee our senior services programming. Today, though, I'm going to talk about both our senior services and our adult group care, or not adult group care, adult services. And then Jennifer Kelly, she's going to be talking about children's services. So I'm going to see, I've never shared my screen on Zoom. I've done it on Teams. So I'm going to give it a shot. Share. Sorry, bear with me. Oh, it's not letting me.
Abby, I can see if I can pull up your presentation from my end if you would prefer.
Yeah, why don't you give that a shot? Because it's blocking me.
Let me see.
Some setting I'm sure my husband has on here.
Give me one quick second and see if I can pull that up.
Okay. Thank you. Oh, it's letting me now.
Perfect, we can see it.
Perfect. All right. So I'm just going to give a really fast, brief overview of Human Services Agency in general. And the Human Services Agency consists of 3 different divisions. We have the Children's Services Division, Adult Services Division, and the Senior Services Division. Senior Services was its own separate department up until, Milo, stop. Up until I believe it was 2017 or 2018, it came under Human Services, and so now Human Services covers, from birth all the way through death. So we cover the entire lifespan. And then I've been with Senior Services part of it since 2016, but I've been with Human Services since 2003, and I spent the first 13 years over on the Children's Services side. So that's the quick overview. So I'll start with adult services. Everyone has, I believe, this entire data book. This is something that we produce for stakeholders, for the community, for everybody. So I thought this would be a good way to present many things that we do. We're not going to be able to cover it all, especially on the children's services side, but it gives you an overview. And then if you have any questions about it, I'd be happy to try to answer it. I'm going to skip adult group care. Mostly because it's such a small program now. We only have, it says 7 in fiscal years 2019. In fact, we're down to, I think, 4 people in the program, and it's somewhat of an archaic program that we just don't have the ability to continue supporting like we used to, but we still have certain individuals that can qualify for the program. The problem is many of our group homes aren't taking our clients anymore for various reasons. And so it's just not a robust program like it used to be, as you can see back in fiscal year 2017. And this is on our adult services side that I'm talking about. So we have our burial and cremation program. And so this is a program that we are able to offer for individuals who were indigent upon their death. And therefore, people can still bury their loved ones, have them cremated, and not incur that expense if their loved one didn't make those arrangements due to indigency. So this is one of those little known programs that we have within our agency. Adult services is mostly known for their Crossroads program. I apologize for my dog. I'm sure everyone's used to dogs and kids in the background now, but he gets really pushy when I'm talking. So our Crossroads program, we have, was there a question?
Let me interrupt you for a second, Abby. I just want to mention, this is Catherine. We do have a few students who are visually impaired. If you have any pictures or anything on your screen, if you could provide visual descriptors.
Absolutely, I will. Thank you. For our Crossroads program, we have both men's Crossroads program and a women's Crossroads program. This program has really expanded, and the expansion right now has been on the women and family side for Crossroads. And so this is a supportive living environment. It's not a substance abuse treatment, although there are substance abuse treatment groups and therapy and classes that they can do. Primarily, it is the supportive living. So those individuals that are addicted to substances, many of them wind up in homeless situations or not safe situations. And so this provides them a housing place that's safe. And so that's why it becomes that supportive housing program. And therefore, they're able to get clean and sober and do so in an environment that is really conducive to maintaining that sobriety. And so we have our men's Crossroads that's contracted out with Catholic Charities right now, and then our women's Crossroads program. And so there's the women's Crossroad is kind of spread out throughout the community. I believe there's 5 different houses right now that women can go to. And they also have the ability to have their children with them in this program for the women's side. And so it's just been, it's pretty spectacular when you look at the numbers. This program came out of, I believe it was, I want to say back 2015, 2014, somewhere in there. They were seeing such a turnover in the jail system and also in the hospitals with people who were addicted to substances. And so they wanted to try something new. And out of that came this program of let's provide them supportive housing and see if we could be successful with getting them out into the community. There's also an off-road, Betty. Hi. There's also a off-campus Crossroads, which is called Croc. And that's housed out of Sober 24, which is on 6th Street. And so for those individuals that may have already a supportive environment to maintain sobriety, this provides them some services off-site as well. I'm going to not talk about our therapy program with Alta Vista Therapy because that is changing a little bit. This data book was from fiscal year 19, and so we're making some changes. And part of those changes are because of we are opening on the NAMS campus. You may have heard of Our Place. And so the county, the state has leased to the county many of the properties that are on the NAMS campus. And so we're reviving the NAMS campus, and it's going to become a homeless shelter for women and families. And so many of our therapy services, and this screen talks about Alta Vista Therapy, are morphing into some other things. But I did want to touch on Our Place and that expansion. So it's going to be women, and then it's going to be women who are pregnant, and then there's going to be a family shelter as well, and there's going to be a senior wing for seniors who are homeless. And so that's actually some of the facilities are going to be opening this summer, is my understanding. And this was an effort to not have men and women housed together at that Record Street location, and trying to really keep everybody safe and making sure we're meeting the needs of the community. And so that doesn't have a slide on here, Our Place, because it's a program that's still just getting up and going. And again, this is in reference to our data book that we give out, we do yearly. So we also have the MOST team, which is our Mobile Safety Outreach Team that works in conjunction with the city of, or with Reno PD. And they are out and about within the city limits, and they respond to crises, they respond to homeless needs, many of those sorts of things. And correct me if I'm wrong, I have 15 to 20 minutes, correct?
Yes, We're looking at 9:13 right now.
Okay.
We'll have to be done about 10:15.
Okay, I just want to make sure I capture everything. So I'm going to,
Great.
because I'm just still on the adult side. But our MOST team, they really have a beat on what's going on in the community with our homeless and our individuals who suffer from crises. And again, this is just for those that you can see on the screen. There's a lot of data on here of who gets served through the MOST team, and they keep pretty good records. Very briefly, we have what's called a LIDF program, which is for our low-income housing, and this supports those individuals who may need some help with rent, and they can't quite make it, but they have the income that they can show that if they just get this 1 month or 2 month help, that they'd be able to maintain their housing longer. And so this program really just fills in that gap for individuals, and they don't have to be clients of ours in order to use this program. People from all over the county are able to utilize it as long as they meet their criteria.
Abby,
Yes.
can you speak to the family shelter and if men and women are allowed to be housed there? One of the questions that came up.
Okay, thank you. So the family shelter, you know, I'm actually unclear right now on how the family shelter operates because that's through the VOA. But with our place, the plan is that whole families can be sheltered together.
That's how the family shelter is currently too.
Oh.
As long as domestic violence obviously isn't a component of the relationship, families can remain together, yes.
Thank you, Jen. All right, I'm going to touch on senior services. This is more my area of expertise. Senior services has many programs under the roof, and I will just briefly touch on them. We have case management. We serve about 200 seniors, and for us, our definition of senior is 60 and over, and that has to do with Older Americans Act monies and some other federal grants. I know there's a lot of definitions out there for what a senior is, but our definition is 60 and over. So we have case management that just generally talks about case management, or not talks about, but with case management, when you think of case management, anything you can think of, it's that organizing their life, it's making sure they're getting to their doctor's appointments, it's dealing with that day-to-day crises. If they have difficulties paying their bills, we also have a representative payee program, and we can put them on a representative payee, and therefore we can make sure that all their bills are being paid. We have a homemaker program, which is probably our most in-demand program. And the homemaker program has individuals come into their home and do light housekeeping, maybe grocery shop and those sorts of things. It also gives us a possibly a weekly or every other week visit into the home by an individual to make sure that our seniors are doing well. And then we have our Daybreak program, which is, and again, I just want to preface this, that all these programs I'm talking about are not functioning the way that they typically would be with COVID-19. So if there's any questions at the end of what we're doing currently, I'm happy to address those. I'm just talking about how we were functioning before March 1st. So we have a Daybreak program, and there are three adult daycares in the community, and those daycares actually serve 18 and over. That's not a 60 and over program. We have one housed at the 9th Street, and that's a Washoe County one at the 9th Street Senior Center, but there's two other ones in the community that I should mention, which is the Continuum, along with the More to Life. Sorry, I was trying to look at the chat at the same time, but I don't think that works very well.
Abby, we have a question from one of our students.
Yes.
Since this is a Partners in Policymaking course, what would you want to see become a law in regards to the services that you provide?
Services in general for senior services? I would have to think on that as far as putting it to the point where there things are in place as a law. Let me think about that as I go through and see if I have a answer that doesn't just come off the top of my head.
Great.
We also have meal programs, and I think when I think about law, I think about making sure that these programs possibly could be funded and making sure they're funded, especially for our food insecure individuals. Because we do home delivered meals and we also feed people on site with our congregate meal sites. And so we feed, right now we're feeding about 1,500 people every week at our home delivered meal sites, and then close to 500 people at our, or actually right now 300 people at our congregate meal sites. So to answer your question, I would say making sure that we continue to have funding to be able to feed our food insecure individuals. So going through these slides a little bit more, it talks about just our stats for our home delivered meals. We are on track of doing more than 450,000 meals this year. I wouldn't be surprised actually if we hit closer to 500,000 based on the crisis that we're currently facing. So just keeping in mind again that this is a policy and partnership policy class, sorry. We do have other services out of our building at our 9th Street Senior Services location that I should mention. We do have Washoe Legal Services that is there that helps individuals over 60 specifically to our program. And they help people with rent, unfair evictions, wills, durable power of attorneys, and those sorts of things. And I think that that's a very important service that's offered that I'd like to continue happen. And then I think we have some various things that I'm sure I forgot, but I know that I'm hitting my time, and so I want to leave some room for questions.
I have a question. With the COVID-19, are you guys still like, how would that work with the home delivery program?
With the home delivered, so we are still providing home delivered meal service. We're screening every single individual before we go out to the home. So we will call them ahead of time to make sure that they don't have any symptoms. And if they do have any symptoms, we have a process in place to make sure we can still provide them their meal, but make it so they're not, that we're not exposing ourselves to them, nor are they exposing themselves to us. So we have a process in place there. We've actually increased our individuals by about 300 just in the last 5 weeks or so that are getting served our meals. So we've upped our numbers and we're continuing to provide meals because we don't want seniors to be leaving their homes. And so we are putting a lot of things in place to make sure that that happens.
And I have another question. I was wondering, with the, I don't know if this is your area of expertise, but with the shelters, like I know people get with the family shelters and women's shelters, how does that work with people with disabilities?
I don't know. I'm not as familiar with the shelters themselves. I know that, and I know that they are ADA compliant, especially at the new shelter at our place. They are making very concerted efforts to meet the needs of all individuals. And so they're ADA compliant, along with some other things I believe that are in place. I know with our senior services side, we have many tools that we use to meet the needs of everybody, but I wouldn't be able to speak specifically to the shelter. I could get that answer for you though. Not today, but I'd be happy to send that on.
Okay, thank you.
Great, and we have one more question from one of our students that says, what outreach are you doing, especially in the rural areas?
So for us specifically, we just have the county. Obviously, there's rural areas in there. We do have a senior center out in Gerlach. That not only provides meals for our seniors, but also provides meals for the children that live out there. And so we have services that are out of there as a hub. And when I think of Washoe County, that's probably the most rural area that we served. We do have services out in the Incline. We have an Incline Community Center that we're able to offer services out of through there. But otherwise, we serve just Washoe County. And we do Meals on Wheels all the way out wherever they need to go within the county. We're able to serve, and we do have a partnership with Rainbow Bend. I know that's not very rural out in Story County, but we do provide congregate meals to them as well.
Great, thank you.
You're
And in light of making sure that we give all of our speakers enough time, we're going to go ahead and move on to Jennifer. And if you guys have any questions for Abby, Abby, do you mind hanging around for a little bit and they can still ask at the end of Jennifer's presentation as well?
Not at all. I was actually, Jennifer, do you still want me to share my screen and use the book?
Please, because I'm not sure that I'm going to be able to do that. So, and Abby, I can just, as we go through, I'll tell you kind of the slides that I focused on more because, so my name is Jennifer. I'm a supervisor with Children's Services. I've been with Children's Services for about 10 years. So if you want to go ahead a little bit, Abby. So this is where I'll start. So I'm going to give a broad overview of some of the services that we provide. Our agency actually has many layers to it, and it would be too much for us to go over in detail in this amount of time. And I would probably forget half of it anyways. So I'm going to do my best. And again, if you have questions, please just ask. For Children's Services, for the child welfare portion of Children's Services, that starts by our intake workers taking a report. This slide where we're starting out shows the reports that we receive broken out by month. So we get around 500 reports a month. Some months are higher than that. Some months are lower than that. When these reports are received, the intake workers are looking to see, are they meeting criteria to be assigned as an investigation where somebody's going to go out and meet with the family. Some of these reports we're taking as information and keeping in our systems, and some that don't meet criteria to be assigned as a report or but are still found to be in need of maybe some community services and some outreach. We have people we call differential response workers who are able to go out and meet with those families. So for 2019, we had, you can see on the screen there how many investigations, but there's a lot assigned each month. So, yeah, keep going. There, that's good. Can you just stay there for a sec? No, the next slide, Abby. Page 10. So this talks a little bit about the breakdown of how we classify the reports that we receive and what's coming into our agency. Across the board, there's reports that we take legal custody of the children for all of these reasons, whether it's a physical injury, whether it's neglect. So anyways, once we take legal custody of the child, we are then working closely with our district attorney's office, as well as our Washoe County Family Courts to make sure that we are, protecting people's rights as much as we can, their right to counsel, their right to go to court, their right to know what the agency, why we're involved and why we've taken the step of filing for legal custody of their children. There are reports that don't meet the level that we're going to be involved with the family legally. We can still work with them as far as helping them with community resources and helping ensure that whatever reason they came to our agency's attention, that we help them overcome that to the best that we can. We have timelines that we have to respond to reports. Some of them we are responding within 3 hours of that report being received by our agency. We have to be out meeting that child, or at least making concerted efforts to meet that child in the community. There are reports that are coded that we need to respond to within 24 hours. And then some of the less severe cases we're responding within 72 hours. So that just kind of gives you a timeline of when we're meeting with families. Can you skip ahead to page 38? So once we're involved with the family, it's important that that parents are able to maintain contact and visitation with their children. We now have the Family Engagement Center, which is a beautiful facility. I love it. It's over on Howard and Prater on the corner there. I don't know if anybody has been there. Families used to come to our building down on Center Street and have like a small room, Abby's smiling, to visit in, and it was not very family friendly. Social workers would pop in and talk to the parents and interrupt their time with their children. And so we now have a building dedicated to families. This building has a huge industrial kitchen where families can prepare food together. It has a pantry. They work with the food bank, and families can access food there at the visitation center. They have beautiful rooms. It's brightly painted. It's clean. I'm not sure if the playground's completed yet, but they've been working on putting a playground in. It's a place where parents can have dedicated time with their children without being interrupted by caseworkers, and they can engage in some meaningful activities there. So that is an exciting development that we've had. The other part of being involved with children is that sometimes they're placed in foster care. So yes, thank you. So we have a whole division of our agency that's foster care licensing. They also work with recruiting homes for foster care. So working with them to make sure they meet the requirements to become a licensed home. And then following up with them consistently to make sure that they maintain those requirements once they're issued a foster care license. So we have children placed in licensed foster homes. We also have children that can be placed with relatives or people within their family network. And this group of individuals would also work with them and help them to become licensed if needed. And if you go down a little bit farther, the slides talk about, I think even a little bit more. No, not that far. The slides talk about some different types of placements children may be in. They may be in specialized foster homes where they're more specific to children who may have behavioral issues that their needs can't be met in a regular foster home. I don't know if anybody's heard of Kids Cottage, but that's what we would refer to as a congregate care for the children. More and more we're using that less. We do still have to rely on that at some times. However, it's much more preferable for children to be placed in a family setting for all the reasons that probably come to your mind thinking about a home versus a big facility. The other thing, and I don't know where the slide is, on page 45, I think I was going to talk a little bit about that I think is unique that I was excited to learn about. We have caseworkers who work specifically with youth that are age 14 and older. And they work with them. It's the independent living. They do independent living with these youth to help prepare them to be successful adults. So they're working with them on how to obtain a job, how to fill out applications, how to do laundry. I don't know what else. Anything you can think of having a teenager that you want them to be prepared to be able to do when they graduate from high school. Our workers work with these youths to help make sure that they're prepared for that. So I'm going to go on a little bit from there. No. So another area of our agency is the adoptions unit. These are caseworkers and social workers who specifically work to find permanency for our children in as short of time possible. There are certain things that have to happen before an adoption can take place. And this is their job. So you can see we work hard to find permanency for the children that we work with. We have an adoption day. I don't know if anybody's seen Adoption Day, if they've been watching on the news or happen to be at the court on the day that this happens. But our agency has tried to really celebrate this milestone for children and making it a positive memory. There's refreshments, balloons. One of the last ones I went to, they had a little photo booth, so the kids could celebrate with their families, and it's a really nice time for them. 2019 was a big year. You can see by this graph, there was 200 children who were finalized in their adoptive families.
So I just want to pause for just one quick second. Two things. One of our students wanted to point out that the location on Howard and Prater is on an RTC route for those of us who use public transit.
Yes.
And Sarah Horseman also wanted to mention that she adopted her son in 2009.
Nice. Congratulations. Also, you don't need to go back to the slide, but with regards to the Family Engagement Center and visitation, they have staff that are called engagers that work with families to help make sure their visits are going well, to help problem solve if there's issues around their visits. They also help with the transportation piece. It's often that families don't have their own vehicle and can't drive back and forth to visit. So they'll work with them. There's even times that they've gone and picked them up themselves to make sure that they can get to their visits to see their children. So it is on the bus route, which is great. There are people who aren't comfortable taking a bus, or because of the time allowances, they're not able to do so, but they can still visit. So we do work often with the family shelter. Right now, the family shelter is over on Record Street. We have some, they're called human services support staff. They're very knowledgeable about the programs in our community. They work and do case plans with the families that are living at the family shelter to help make sure they can get out of the shelter and be successful, whether that's, finding daycare so they can obtain a job, learning how the bus system works, accessing community benefits. They really try and wrap services around families so they can make the most of the time that they're in the shelter and be successful when they leave. So we work with them all the time, and we will continue to work with them when it becomes our place. I know the people at Children's Services are looking forward to having more help for the families that we come in contact with, and I feel like that will be a huge benefit. The court liaison program. I don't want to touch on the court liaison program. I do want to speak about our specialty. We have a unit that deals with, I'm at a loss for words right now, Abby, the
Specialty courts?
yes, specialty courts. I'm sorry. We have a unit of workers who work with parents who are involved in specialty courts, whether it's for adult mental health issues or substance use issues. They have a higher degree of oversight from the court, and it's a pretty intensive program where they're involved in services, they're meeting with their worker, and they're going to court, I believe, every other week to check in with the judge. So families and parents who participate in that program, if they work the program, are oftentimes much more successful in the long term because it's such an intensive program.
We have another question from a student in regards to, I guess, the children that are in your programs. Can you drop off donations like toys and kids' clothes, gently used or new?
I didn't hear you. Can you say that one more time? Can you drop off donations?
Correct. Can you drop off donations like toys and kids' clothes, either gently used or new?
Yes. We do take donations. A lot of people reach out directly to the Family Engagement Center and provide donations there. I would suggest that you not just stop by the building and drop them off because nobody's going to know they're there or know what to do with them. But if you reached out to myself or someone at the agency, they would be able to accept that donation. So yes, the answer is yes, we take that.
Thank you.
You're welcome. I'm sure I'm missing huge parts of what happens at Children's Services. It's a large agency. Does anyone have specific questions about what we do or other outreach that we might do?
Can I actually just interject real fast, trying to be mindful of the group? For Children's Services side, everything that is done for the most part is under NRS 432B. And so that's the law that we have to abide by. And then there's federal law, there's ASFA, which is Adoption and Safe Families Act. But most of what we do and what our policies are written off of is 432B, NRS 432B. And then for the foster care side, it's NAC 424. If I have that right, and I believe NRS 424 also talks about the foster care side. There's other laws, but those are the big ones to be aware of for the Children's Services side. And we don't have that on the senior side, NRS specific to talk to you about our programming and what we do, but the Children's Services side does.
Great. So we actually have a question from one of our students as well in regards to your Meals on Wheels program. Do you guys label the food as what is inside the Meals on Wheels meals?
Yes, we do. So the Meals on Wheels are actually frozen meals. They get a hot meal that says what it is, and then frozen meals, and it is labeled of what is in there, what the meal of the day is. And we have a menu that goes out every month as well that talks about what the individual meals will be.
I have a question for the children's services. In regards to mental health, how does that go?
So that is something that we deal with frequently. There's a couple different ways that we try and meet that need for our families and our parents. We have a program where it's called our voucher program. So we can make referrals to providers in the community to do evaluations and ongoing services with people, even if they have not yet, or if they don't have insurance. So our agency has contracts and can put referrals in to make sure people can follow up with that in the community. We also have a clinical, we have clinicians who work in our agency who work both with youth who have mental health needs, as well as families or parents who have mental health needs. And so we can also refer within our own agency, so those people don't get missed and they can get the services that they need. We also work with the mobile outreach, the MOST team. We can make referrals to them if we need to. If it's a urgent need and we need somebody to be available now, we would either reach out to one of our clinicians or even to the mobile MOST unit or the mobile crisis unit.
Great. Do we have any other questions? Please feel free to send them in the chat or unmute yourself and ask away. Okay, so I don't see any questions coming up right now, but I do want to also thank you guys for taking your time to present to us today on a Saturday. And I know that with everything that's going on, can you please just address the simple topic of COVID and how your guys' organizations are adapting to these ever-changing needs?
So for children's services, we've done a great job. Actually, the county has done a wonderful job of helping us get set up so that we can work from home. There's actually very few people going into the building. And there are some supervisors and some assessment workers that are going into the building. There's some front office staff that are going in there, but very minimally, like a couple a day. We are working from home. We still are going in the community, especially when we're receiving those reports that children are being abused or neglected. We're still having to go out. However, people have gloves and masks and hand sanitizer and wipes, and they're taking every precaution. They're not going in houses if they don't have to. They're meeting with families outside if the safety if there's not a safety reason that they need to go in the house and observe that. So that is how we are handling it at this time.
And then I can speak to how senior services is handling it. And one other thing on the children's side is that caseworkers are required to do monthly visits with their children in foster care, and many of those visits are happening just like this, or FaceTime or some other thing. And also the visitation with parents is happening. People are getting really creative, but they're visiting via FaceTime or Zoom or Skype or however, anything that can be done on a screen, they're doing it that way. As far as senior services goes, overnight we changed how we do our congregate meal plans because the idea of congregation is just not a thing anymore right now. So we do at all of our, we have 9 locations, we do a takeout method. And so we have, we have lines out the door with the 6 feet apart, and we give people a bag of what would have been their hot meal that they would have eaten at the senior center. I address Meals on Wheels. We continue to do that, and we actually have exponentially grown that program. All of our buildings are closed to the public. And then as far as our individuals that are on case management, our caseworkers have been having very regular contact with them through the phone. On the few that don't have access to a phone, we are doing actual check-ins to make sure that they're doing okay and doing a welfare check, for lack of a better word. And obviously taking as many precautions as possible and using the PPE that we do have available to us. But we have changed the way that we do business.
Great, thank you for that. We also have questions on what happens to the children who age out of the foster home, and are there resources or services available for them?
We do have a program for youth that age out of foster care. Abby will have to help me fill in some of this, I think, but they are eligible if they're engaged in attending school. There's special funds that are available for them to help them go to college, and there's federal funds available to help fund that. During that time, between the time they're 18 and I believe it's 21, they still have their caseworker that they've had at the agency. That's what they do, is work with those youth, those age out youth, to make sure that they're being successful in the community. So we don't want somebody to turn 18 who's been in foster care for a couple of years and say goodbye, good luck to you. They can opt out of working with our agency. It's not something that we force them to do, but it is available to them if they want to continue with that support.
Great, thank you. We have another question, is what laws or regulation is your state lacking? And then what would you guys like to see take place? And I guess this is more of a personal preference and such.
I mean, we have a lot of laws and regulations surrounding child welfare, and I think that they are forever changing, and language is changing, and making sure we're continuing to do best practice and it's in line with the laws themselves. I think that for on the senior side, I'm trying to think of what recent laws didn't pass that we're frustrating to not see. I think having the support, and this is my own opinion, so just preface that, not Washoe County Human Services, but being able to have those resources out there to support our elder population. Many of those, mental health didn't start when they were 60 or 65. They had that throughout their life. And so they may not have put in the right resources and put in the right, and to set it up to take care of themselves. And then they are often at that point homeless, and there's not all the resources out there for them. And it's hard because of our community, trying to figure out where they can go, where they can stay safe. And so I think I see that a lot. We have one program I didn't mention is we have what's called TADS, Temporary Assistance for Displaced Seniors, and it only has 14 beds. And that many of those that come in there, they had a chronic homeless situation. And at that point, it's hard to get them out, but there's also not the resources in them to take care of them long term. So I think that would be the thing that I see the most, that we get in these predicaments and we don't know how to help these seniors because they don't have an income, and it's not like being a 30 or 40-year-old and they're just able to go out and get a job. And so it's hard to figure out what to do and how to help them.
For the children's services side, I don't know that I can speak to a law or a regulation that I think needs to be in place. But what I will say is we have a very dynamic agency. We have a team called what's CQI stand for, Abby? Quality
Assurance or quality improvement.
Yes.
Continuing quality improvement, I think.
Thank you. And so they're constantly looking at how our agency is doing with meeting timeframes, with meeting the needs of the children. how we're doing working with families. They're constantly working with other children's services within our state, including Clark County and the rural areas. They consistently do reviews of our cases to make sure that we are following the laws and regulations that are in place. And then based upon those reviews, they can provide suggestions to us, or maybe even change the way that we practice on a daily basis. So it's something that's happening every day at our agency, and it's taken seriously. Just making sure that we're following up the best that we can and helping the children and the families in our communities the least intrusively possible. We don't want to be taking families' rights away, the right to parent their children, but at the same time, we want children to be safe within their own homes. So it's a constant balance, and it's something that we're working on all the time.
Great, this is awesome. Does anybody else have any questions? This material to you guys and the contact information of our presenters, so you can connect with them if you have specific information or questions in regards to your situation. And I do just want to say that several students have said thank you, that this was very informative to stay safe and happy and healthy in this time.
Thank you.
Thank you.
Thank you both. Okay, students, I do want to let you know that we are on a break as of right now. We will regroup back at about 10:15. You can stay in the meeting if you'd like, or you can leave the meeting and rejoin at 10:10 so we have enough time for our presenters. I will be muting and turning off my video, so if you need me, you guys have my cell everyone, if you guys want to start gathering back, we are just waiting for our next presenters to join. We will then go. Okay, so we're going to go ahead and get started so we can stay on track. We have both Cheyenne Pasquale and Jamie, and I don't want to butcher your last name, so I'm going to allow you to introduce yourself. You guys are, we have both of them from Aging and Disability Services, but they are from a different unit, so I'll allow them to introduce themselves and what they do, and they can go ahead and get started. Cheyenne or Jamie, if you'd like to share your screen, right at the bottom is the option to do so.
Okay, thank you. Oh, hold on. Okay. Well, good morning, everyone. How are you?
Good.
Great.
Good. So my name is Cheyenne Pasquale, and I work in the Planning, Advocacy, and Community Services Unit here at Aging and Disability Services Division. And Jamie Ahumada is my colleague, and I'll let her introduce herself in a moment. But our unit is responsible for oversight of all of our grants and our community services that we offer in Nevada. We have a number of different programs that we do in-house. So we have our assistive technology for independent living. We have a Medicare counseling program. We have our aging and disability resource centers, a taxi assistance program. There's a lot. We also are responsible for helping to support 5 different advisory boards in Nevada. And then we also are responsible for some strategic planning and whatnot. I've worked for the division for about 8 years, and I love every minute of it. And I am excited to be here with all of you today. I was looking forward to being in person, but here we are, loving and embracing technology. With that, I will turn it over to Jamie to introduce herself before we get started.
Hi, everybody. My name is Jamie Ahumada, and I work with Cheyenne, and I've been in this unit for about 1.5 years now, and I absolutely love it as well, and I'm really excited to be here today.
Thank you, Jamie. Okay, so today we are going to go through quite a few things, but we'll start with some definitions, and then I'll turn it over to Jamie, and she'll talk about person-centered planning, or what we in Nevada call resource and service navigation, and individual roles in that process. Then Jamie will turn it back over to me, and I will talk about self-determination and supported decision-making. And we'll wrap up with Jamie talking about natural supports, including what they are and how to get them. So I will say that I tend to make a lot of dumb jokes. I'll try to keep that as a minimum as we go along, since I don't know how they're going to be perceived, everybody. But I hope that you find this information helpful and you have some fun, and we will pause after each section for questions and whatnot. So, okay, let's get started. So let's start with some definitions. So within our system, as we in Nevada have been working to better support individuals in living the quality of life they desire, we have been working on a project that we call No Wrong Door. And within this system, one of the key functions is something that we call person-centered planning. And this is a process that develops service plans that reflect the services and supports that are important to and important for an individual. And so so with that is also the concept of self-determination, which says individuals have the opportunities for respectful support and They have the authority to exert control in their lives, to direct their services, and to act on their own behalf. Finally, we have supported decision-making, which supports and services that help individuals make their own decisions. So with that, I'm going to turn it over to Jamie. And Jamie, I'll just advance the slides.
Okay, thank you. Hi, everybody. Okay, so let's talk about person-centered planning. Next slide, please. So person-centered counseling. So like Cheyenne mentioned, it is called Resource and Service Navigation. And this service is offered to individuals to help explore their options. It's interactive, so the process is to help build that partnership with you or with the individual seeking for assistance. And for us to learn about goals, plans, our needs, our values, where all the options for services are explored, and we can plan to reach those goals that are created. And I apologize if I'm not looking at the screen. I'm still learning, so. So our goal through resource and service navigation helps put you into the center of this whole plan, of this whole process, and we take the lead from you. So it is really just to help support you in making your informed choices in how you want to be supported. So next slide. So I know by now Cheyenne and I have given you a lot of information to kind of think through and think about in your own lives as you're thinking about what you need in your life. So what does this all mean for you? Next slide, please. So the groundwork for resource and service navigation is that you're in control of the meeting that we have about planning and about your life. So this is a good opportunity to be able to share your dreams, what you want in your life, where you want to live, how you want to live, and you choose what services you want and which ones you don't want. Because I think that that's important to be able to voice the wants and the do not wants. You choose what services, in order to reach your dreams and your goals, you need to also be an active participant. So that's why we look to you to be a part of the discussion, to plan and be able to succeed these plans as we move forward. You are the center of the whole resource and service navigation process. Next slide, please. So you get to decide, what's important to you. You are in charge, and just, always remember that when you are talking to a resource and service navigator, that they're there to listen, to hear what it is that you need, how you feel, what you're thinking, and just know that you can always change your mind and you can always say no if an option is not, that's presented is not what you're wanting. Next slide, please. So really, the reason why we have person-centered counseling is because you are the expert about you. You know what's best. You know your talents, you know your skills. And so we're just here to support your choices and know that you can always, again, change your mind. You can always say no, and we can always change the plan. The plan is never concrete. It's always just there for you to be able to grow and learn from. Next slide, please. So you are supported, and to know that you're supported, you can think of the resource and service navigators as your team. They're your cheerleaders for you. So I I want to go over these bullets, and we can say them out loud together if you'd like, because I think that saying these things out loud sometimes helps us, really reinforce that you are supported. So the first bullet is, I choose who is on my team and I lead the team. I am treated with dignity and respect. My wants and wishes are listened to. I am responsible for taking actions towards my supports. And that's it for me for person-centered counseling. Does anybody have any questions about person-centered counseling?
We actually have a question in our chat. Can you give some examples of how long a participant stays in the program and what does that look like?
So it all depends on each individual, and so it could be something short term where it can be just a process to figure out what your plans are and how you want to achieve those goals and give you those tools to do that. It can range anywhere from, I believe, 30 to 60 days. And Cheyenne, please feel free to chime in. But it is a short-term process as far as being able to figure out those goals and those plans and then help you get to those goals. But if somebody does need a longer term to have these supports and reach those goals, that is also an option as well.
Yeah, I think, Jamie, am I on mute? No. Okay. I think you summarized it well. So it looks like Dora asked that question. What happens when you come into a resource center? They will get some initial information about you and what it is that prompted you to call the resource center, and then they schedule the appointment with the navigator, and that person then begins to work with you to help you identify goals, help you identify different programs and services and supports that might reach those goals. And then they'll help with applications, they'll help with conversations, whatever it has to be. And Jamie's right. I would say on average, people are involved with a navigator for about 60 days, probably. And their role really is to be that hub and help you connect with other programs and services. So that's that. And then it says, Dora, it looks like you also asked how long is the waiting list? Right now, particularly because of the COVID-19 situation, I would say it varies across our resource centers, but you can usually get an appointment with a navigator within 2 to 3 weeks is the average. So it's not like our traditional programs and services where there's a lengthy application process or anything like that, because we have no income requirements. We have no specific requirements in terms of disability types or anything like that. It's really a service for anyone that needs some assistance in helping to explore programs and services to help them be successful and reach their goals. So it's a pretty different program compared to a lot of traditional state programs, I would say.
Yes.
Are there any other questions? Okay, then we'll go ahead and go on to the next section. And that is, so in this person-centered process, both the navigator and you as the individual have certain roles. And so this section, we're going to talk about your rights and your responsibilities as a participant in a person-centered system. All right, so first, You have the right to not be discriminated against based on race, ethnicity, nationality, age, sex, religion, physical disability, sexual orientation, source of payment, or ability to pay. You have the right to be treated with respect, privacy, and dignity, and to be free from threats, harassment, bullying, and intentional injury at all times. And you have the right to receive unbiased and accurate information and assistance. That means that I may like one choice in services, but I'm going to give you all the choices that I am aware of so that you make the choice, because the one that I like may not be the right one for you. You also have the right to include family, friends, or any other persons of your choosing in any decision-making and in your personal resource planning meetings. You have the right to control your life, decisions, and the services provided to you by accepting or refusing any information, services, or referrals provided to you by your navigator. You have the right to a financial eligibility determination for publicly funded services and to be informed about programs for which you may be eligible. You have the right to have all personal, financial, and medical information held confidentially and to not be filmed, taped, or photographed without your consent. You have the right to be informed verbally and in writing of your rights and responsibilities and to file a complaint when necessary. All right, so what do you guys think about those rights? Did we get them right?
Cheyenne, we do have a question from one of our students asking, what about developmental and mental health disabilities? Primarily the mental health side.
So our navigators are trained to help any individual regardless of their diagnosis. And we know that there are certainly some areas and some populations that have more choices in services than others. But we do our best to help our navigators be informed and to get to know all of the services and options in their community so that they can help anybody that comes in and wants help looking at long-term services and supports. Did that answer the question?
The rest of the question is in regards to discrimination. The slide said physical disability.
Right. So, and this is part of the, oh my goodness, I can't even remember now. But we do not discriminate against any disability. So that is probably something we should edit in our language.
I said I'll make a note of that.
Thank you, Jamie. That's a good catch.
As a reminder, students, you can always send questions or comments through the chat.
Okay. So we'll keep going here. So we talked about your rights. Now let's talk about your responsibilities. Boo. Oh. But we all have responsibilities, and in a person-centered process and a person-centered system, it's important for us to recognize what our individual responsibilities are. So as you're going through this process, you have a responsibility to treat others with respect and dignity. You have a responsibility to not engage in illegal and/or dangerous behavior that puts you or others at risk. You have a responsibility to be an active participant in your resource and service navigation. by making decisions and considering and selecting resources that best meet your needs. You have a responsibility to provide accurate and timely information about yourself to assist in the eligibility determination and resources planning, and to provide any pertinent changes in your situation. This can include needs, income, address. You have a responsibility to notify your resource and service navigator when you need to cancel or reschedule an appointment. Seems easy enough, right? Not too much responsibility. All right. So that's your rights and your responsibilities in a nutshell. Our navigators will be there for you to give you the best and most accurate information that they can, and treat you with respect and dignity. And in the end, that's what we expect from you. So, do we have any additional questions about rights and responsibilities? Okay, well then we will go on to self-determination. And this is your choices. So let's talk about the definition of self-determination a little bit more. What we say is that people have the same right to and responsibilities that accompany self-determination as everyone else. You are entitled to opportunities, respectful support, and the authority to exert control in your lives, to direct your services, and to act on your own behalf. Makes sense? Yes? All right. And in self-determination, you have allies. They could be family, friends, or other individuals. And they have a critical role in promoting self-determination. They have to respect their limitations on their own authority. And if it's professionals, we have to recognize and respect individual rights. And we have to recognize our limitations on our authority, right? So that we can help support individuals in self-determination. So your allies will help you as an individual take a lead in decision-making, advocate for yourself, choose your own allies, direct your own supports, acquire additional skills, and take risks. As allies, we're helping individuals to participate fully and meaningfully in your community, receive the necessary supports to vote and exercise your rights as a citizen, to be active members in the community, and to take meaningful involvement in policy making. That's sort of the goal. That's really what you guys have been working on in your Partners in Policy Making class. Yes?
Yes.
All right. Good. All right. So then, as an advisor, oftentimes advisors are compassionate, they're teachers, they advocate for or with self-advocates. So they teach, they participate in strategic planning, they provide support, they provide assistance with meeting management and assistance with resource development. And there was a study, and I apologize, my memory is escaping me today, but there was a study I read, and it turns out that self-advocates use a lot of these same terms to describe a helpful advisor. And they say that a helpful advisor is someone who is compassionate, who is a teacher, who has a sense of mission, and who can help with meeting management and resource development. And based on a review of a number of different articles, there are kind of 5 themes that I've defined that emerge in systems looking to promote self-direction. And those things include advisor functions. So ensuring that staff supporting individuals are fulfilling those advisor functions, that they are being supportive and promoting self-determination. That in self-directed programs, individuals are feeling empowered versus controlled. That there is a recognition of training needs, both for our advisors and for individuals participating. That there has to be planning for advisor turnover. There's staff changes, people come and go in our lives, so we have to be able to prepare for advisor turnover and to make that transition for the individuals we're supporting as smooth as possible. And finally, I think most importantly, in systems that are promoting self-direction, they have to be able to plan for the different support needs of youth versus adults.
Cheyenne, we have a question on the advisors.
Sure.
Or the navigators, I'm sorry. What training does your navigators receive? Are they required to take continuing education units to keep up with the best practice, strength, and base practices?
Yeah, so that's a great question. We do quite a bit of training with our navigators. So initially to, to certify the navigators, we offer training on in-depth training on person-centered planning, on motivational interviewing, on person first language. We also offer training on some tools that help with person-centered thinking and person-centered planning. And then we offer training on all the different public programs. And then throughout each year, we typically will offer about, I would say, 4 to 6 trainings that are kind of ongoing. And they're on a variety of topics. It could be on veterans benefits or topics specific to disabilities, or topics specific to things like housing, whatnot. So there's quite a bit of training that goes in to our navigators, and we are always looking for new ideas and new topics. So we always invite everybody to provide us with suggestions. Did that help to answer the question?
Yes, that's perfect. Thank you so much.
Mm-hmm. Okay. So now let's talk about something that has been, I think, what I call a hot topic the last couple of years, and that is supported decision making. And on this slide, I say supported decision making and alternative, and I'm going to explain what I mean by that here in just a moment. So supported decision making really helps understand the issues and the choices. It gives an opportunity to ask questions. Supported decision making is an opportunity to receive explanations and information in language he or she understands. And it provides an opportunity for individuals to communicate his or her own decisions to others. The the reason supported decision making has been such a hot topic is because it is an alternative, or maybe an alternative to guardianship. So let's talk about guardianship for a moment. Guardianship is a formal legal step that can vary in scope, and there are different laws that are different by state. Guardianship proceedings historically have taken away some or all of a person's rights to make decisions. Guardianship has a court that is involved with the individual and the guardian, and it can really change relationships between individuals. So offering supported decision-making really makes sense. And the reason for that is because it promotes self-determination. It can help individuals be more independent, more integrated into their communities. It can help individuals be healthier and be able to better recognize and resist abuse. I forgot to edit this slide again, but research suggests also that supported decision-making makes sense because it can reduce feelings of low self-esteem. It can actually increase life outcomes where guardianship can decrease life outcomes. And supported decision-making can help to eliminate feelings of helplessness. So when we're looking at options for supported decision-making or guardianship, it's all about exploring alternatives. It's about finding the right support. It's about providing the least restrictive option for an individual. And more importantly, for our allies and our friends and our family, it can often mean rethinking capacity. You know, recognizing that individuals can make some decisions. Sometimes they can make decisions and sometimes they can't. And then sometimes they make decisions with help. So it's really about looking at the individual and what are their support needs, and then how do we find the balance between what's important to someone, so their goals, their values, and then what's important for them, so keeping them safe and healthy and whatnot. So you might be thinking then, how does this supported decision-making work? Well, you know, the truth is that there is no one-size-fits-all method. It looks different for different people and different families. It's really a paradigm shift. And what I mean by that is it's a different way of thinking. It's not a process or a program, but it's about recognizing what that individual's abilities are, recognizing where they might need some support, and then working with that person. And a key question when we're looking at supported decision making is, what will it take to help that individual find that balance between what's important to them and what's important for them? Okay, so those are some key things that we've talked about today. We've talked about so far person-centered counseling and resource and service navigation. We've talked about self-determination and keeping you at the center of the process, letting your voice be heard. And then we talked about some ways that perhaps supported decision-making can be an option to helping you live the best life that you want to live. Before we move on to the last part, do we have any questions?
We do have a question in the chat. The question is, what protection does supported decision-making offer the individual?
Well, that's a good question. And I think this is always a difficult one because this part of supported decision-making is that dignity of risk and the right to make bad decisions sometimes. So in supported decision-making, your support person or your ally is going to do the best that they can to help you recognize the consequences of certain choices, and help you recognize what might happen if you make what somebody else might consider a bad choice. But and depending on how the supported decision, so that is what I would say first. Second to that, though, is depending on how the supported decision-making relationship is set up, it might be determined that there are certain things that an individual doesn't have the ability to decide or isn't able to fully understand consequences. And so then in a supported decision making, that ally might take on more of that type of responsibility. But the goal really is to help people to understand the consequences of their choices and to be able to protect them as much as possible in that way.
Great. So additionally on that question, does it offer protection from scam artists or people who may not be very honest?
Well, not a formal protection. Again, it's helping that individual recognize when there might be a scam artist or a fraudulent person, someone that's not so honest in their life, and help them to see how that is affecting their life and what the potential consequences would be. It's a very similar, I'll give you guys an example. So in our adult protective services unit, individuals are able to make reports on older adults or people with disabilities who may be being abused or neglected, or maybe they're even self-neglecting. And in that unit, let's say that they get a report of someone who is being financially exploited by their son. Okay. The caseworkers, they go and they explore it, and that might be the case. They might be getting exploited financially by their loved one. But they may not want to move out of their house, or they may not want to stop talking to their son. And in those cases, it's very hard for the worker to remove that individual from their home, because they have that right to stay there, to make that decision. What they will do is they will try to support that individual in seeing how things could be better, or how they can reduce or eliminate that exploitation. And in some cases, if it's really bad, then they work with law enforcement. But by and large, they try to support that individual's choice and try to let them know the consequences and the alternatives of what they could be doing.
I have a question with individuals that can't speak for themselves. Supported decision making is an option, but how would that go? I mean, does a guardian just make a decision like that? I don't know if we have a.
Yeah. So in guardianship, depending on how the guardianship case is written, oftentimes what happens is an individual's ability to make all choices is taken away from them. And so then the guardian makes all their choices for them. So in supported decision making, an individual would be looked at more on that individual basis, and they might be able to make some decisions, and then they might give, you know, some decision making to their support person, or they might have to have help when they're making decisions. So they might consult with that support person to help them make decisions. So it's just, it's a slight tweak, I think, you know, but it is a big tweak in the sense that there isn't a court involved in supported decision making, so there's no legal relationship there. It really is about helping that individual get the support that they need and to make decisions to help them live the quality of life that they want in the best way that works for them. Because for some people, they may have limited ability to make decisions. And so they may need more support, and that's okay.
And I wanted to include too, you know, in remembering all of this information is that individual, that person, with a guardian or without a guardian or with that supportive decision maker, they're still a part of this process. They're still in the center of how, you know, we look at the different services and options that are available to you. So they're always a part of it. As, you know, Cheyenne's been saying, you know, it's just that person's still a part of that process. That's all.
Thank you, Jamie.
Yeah.
And we do have a question in the chat as well. Can you talk about your wait lists and how many people you serve?
Okay. So through Nevada Care Connection, we really focus in on resource and service navigation, the beginning part of our presentation. And we serve about 4,000 people per year. And right now, I believe most of our resource centers, there is probably, it's probably 2 to 3 weeks to get an appointment with a navigator.
And then additionally, is it true that some of the individuals cannot be served due to lack of funds? And does your agency have other solutions for these individuals?
So if a person wants to apply for public programs, maybe it's a waiver through the regional center, or it's SNAP benefits or something like that, the Nevada Care Connection will help them with those applications. But some public programs do have wait lists. And so if a person chooses, let's say they choose to apply for a waiver program for direct service support, and they have a wait list, then Nevada Care Connection will try to help them find alternative services until they can get onto the program because of the wait list. But yeah, a lot of our state funded programs, they do have wait lists, unfortunately.
Great, thank you.
Any other questions? Okay. So I'm going to now turn it over to Jamie, and she is going to talk about natural supports. And I'll just say that this is one of those areas where sometimes we try to work with individuals to build up natural supports, particularly if there's a wait list for services or whatnot. So this is a good kind of option that we try to look at. So with that, I'm going to mute myself and turn it over to Jamie.
Thank you. With natural supports, we're going to talk about where to find them and how to get and maintain them. Next slide, please. So what are natural supports? So to answer this question, it may be a little bit easier to look at yourself and think about all the people in your life. So friends, family, co-workers, and the relationships that you have built with these people are your natural supports. And natural supports are also just very, they're those people that you know that you can count on if you need help or if you just need advice or somebody that you can actually just talk to work through things. Again, you know, with natural supports, it's by the definition, it's natural. So just within your own circle of people. Next slide, please. So looking at this picture, you can picture the person, you as an individual. This is your circle, your group of people. So it could be family, it could be people that you work with, co-workers, supervisors, it can be at school, friends, teachers, and anybody else that you.
Jamie, as a reminder, we have some students that are visually impaired. If you could provide a visual description.
Oh yes, I'm sorry. Yeah, so the picture that we have up is it looks almost like a bullet, what is that called? Almost like a bullet point where it's got a big circle, it goes down to a smaller circle, and then that center point.
It's a targeting site.
I'm sorry?
A targeting site.
Yes, so thank you so much. Yes, a targeting site. And in that middle part of that target is you. So all of your supports. So if you can just think about all your little connections with everybody, again, you know, with family, with friends, you know, school, individuals, so teachers, friends that you make through school, and people like that. So anybody that you can think of that you have communication with on a regular basis, and I guess it doesn't necessarily have to be a regular basis, but it can be a consistent basis where you at least keep in touch. So those are your natural supports that you can think of. Next slide, please. So why are these natural supports important? It really does help promote independence, having that support system to help be there for you. And this can be for anybody, you know. Sometimes we look to friends, you know, for advice or to help us, you know, get through some challenges through life. We can look to family for those same supports. And they really help us, you know, be our cheerleaders as well. Just as the resource and service navigators are your cheerleaders and your teammates, so is your natural supports. This will allow you to also, gain confidence towards having a meaningful relationship with your family, with your friends. And so based on what individuals want, not on what professionals want. So that also helps you understand with your natural supports if, when you're speaking with professionals, they're part of your natural support system in a sense, but you always have that ability to say, no, that's not what I want. This is what I want. And as professionals, we just continue to say, okay, and we can shift and go with what it is that you're wanting. So we also support the choices of individuals and provide that safety net. So when things do not go the way that we want them to, they're there to help support you and bring you back up and help you take a different path. Next question, please. Or not question. So how to address natural supports. So an important part of our person-centered planning is that, again, we take a look at the person as a whole. So we take a look at their natural supports. We take a look at supports within the state system. So if you need, a social worker or a case manager, or somebody to help you through those processes in that area, they always take into account your natural supports, as they also want to see that you benefit from the services that are out there. Again, as Sharon had mentioned earlier, there is no single method of making this happen, as relationships are unique, they're different, and they do happen naturally. So it does take time to build supports if you don't have them in place or you have limited natural supports. But there is a way to build and fill that gap with supports within your own community. Next slide, please. So natural supports, how to get them. Next slide, please. So several factors regarding the individual must consider when generating natural supports is you got to know the individual. In order to find a viable channel of networks and resources, the support builder must know you. We need to know, what your interests are, what your likes are, your dislikes, etc. You can begin by collecting information from a variety of people within your own, your own circle, including, the circle that we just talked about, which is your family, your extended family, friends, co-workers. This kind of makes the team grow, not only with the resource navigators, but also with your natural supports, and be able to work together to help find or to help meet your goals, whatever they may be. So we just want to make sure that as support builders, we just want to know what it is that you want without judgment and values getting in the way. Next slide, please. So communication. So communication is a vital feature of knowing the individual, as it enables a consumer to identify his or her needs and desires and wants. As a support builder, it is important to recognize the person's ability to communicate, again, by talking with a variety of people with whom you interact with on a daily basis. And the support builder can help identify a variety of interests to help you build that network. So if you are interested, let's say, in reading books or being part of a book club, there are groups or clubs out there that have those similar interests that you can join and start building those relationships within those book clubs because you have similar interests. So let's see. So it's just a matter of how we relate to one another, and there are no two relationships that will be the same. Like I had mentioned earlier, relationships are unique, and it takes time to build. And, you know, finding those little groups of people that have similar interests are really good ways of beginning to build your natural supports within your own circle. Next, thank you. So persistence. Again, you know, it takes time to create those natural supports, to establish rapport with one another, to build that trust, to know that they are an ally or that they are, you know, wanting what's best for you. So always, you know, just continue to attend groups and meetings and social events. I know sometimes that can be uncomfortable, as we don't, you know, when we join these clubs, sometimes you don't know people, but that's where you take that opportunity to introduce yourself and say, hey, you know, this is something that I really enjoy doing, and start breaking the ice and start talking and making friends. This as time goes, it starts showing the qualities of each of you to bring to the table to these different groups. When the routine starts taking shape as you're, you know, going to these different clubs or these different social events, you become more involved, and just start again, you know, building that larger role in your you start building your larger supports within your own natural support system.
And if I
apologize.
if I can add to that, when we're talking about creating natural supports, we're talking about having individuals support you in building your network. And so this point on the slide that says become less involved, that's really the support builder would become less involved as your routine is built, as your qualities and rapport is built with different groups and different friends and allies. So the goal of natural supports is really, I may be someone that is supporting you in getting to know members of your community and building that network. But the goal is that my role becomes less involved over time, and the role of your natural supports becomes larger.
Thank you, Cheyenne.
Okay. So next slide.
Next slide, yes. So natural process. So as we know, relationships are a two-way street between the individual and either other individuals or the community. It recognizes how people connect with others, so we can start learning from being able to connect with one another, and you really start flourishing those relationships as you go back and forth between these two on this two-way street. Let's see. So the process of how people can connect with others should be recognized. Think of typical people, typical places, typical activities, then identify opportunities that could, where you can see that you have an interest in and the other person has interest in. But also, you know, be realistic. Identify members of the community that are willing and have a wide social base. Next slide, please. So these are some factors to consider when developing a system of support. Focus on specific geographic neighborhood. Learn about the neighborhood with the consumer. Spend time getting to know the people who are part of your local community. Find out about organizations or associations that exist within your own neighborhood. Every group has people who are welcomers, those that welcome you into the group, into the setting, and kind of help you, take you under their wing and help you meet people and make those connections within those groups. If you seek them out, get to know them, ask for ideas, contact, and any assistance too, because those people that welcome others are usually the ones that really bring everybody together to build relationships with one another. So as you develop allies within a group, a social club or community, these are the people who are willing to go back for you. They will be the ones who persuade others to open doors and recognize the contributions that you have to offer. They have connections with other people and will begin developing a positive network system for you. As you develop these allies require the ability to ask, and talk to people you know and who you might know, someone who might know someone else, to just continue to build upon this network. Next slide, please. So additional considerations is, you know, pay attention to natural cues. Know how much and for how long to support individuals. Every situation is unique. There are no rules. Just be aware of when the process takes. This is your cue to be able to start. I'm sorry.
I can jump in here.
Okay, thank you.
Yeah. So as I think one thing that maybe we didn't clarify in this section is that natural supports are important for everyone, but as self-advocates and leaders in your social circles, you might find yourself in a position where you're helping someone else build their own natural supports. And so you want to make sure that you're helping to support that individual, but you're not taking over, I guess, is really the short end of the stick. You're as a support builder, you're going to be a regular person. You're standing alongside that individual. You're establishing circles of support. You want to be available to that person, but not too available. You want to help them to form those relationships and gradually fade away. So it's important to remember that relationships change over time, and that's okay. So you may have a really close friend or someone that you spend a lot of time with, and then over time things change and you don't spend so much time with them, and that's okay. You know, because relationships will grow over time, they will fluctuate, and sometimes they end. And so finally, on that one other thing that is important to think about if you're helping to build natural supports for someone, or if you're looking at being more involved in your community, is to really recognize the individual's cultural background. We have to show sensitivity and respect for cultural backgrounds, acknowledge that culture, the traditions, and the beliefs, and encourage pride and enhance the person's self-esteem, to be in taking pride in who they are. So that is the end of our presentation. So I just want to say that we started talking about, from a service delivery perspective, how Nevada Care Connection is trying to support individual choice, person-centered, build a person-centered system, the importance of self-determination in that process, and then we ended with the concept of natural supports and building a circle of friends and allies around an individual. And you may find yourself doing that, or you may find yourself needing a support builder in your life. Either way, there's a lot of opportunity and a lot of value in having that system of support. So with that, we will end our presentation and open it up for any questions.
Just a quick thank you to both Cheyenne and Jamie for presenting today, especially on a Saturday. We super appreciate you taking the time out to be here with us. As a reminder to students, you can either unmute yourself to ask questions, or you can chat in the chat as well. And it looks like you have a couple students that are thanking you too for your time. I'm going to give everybody just a minute to kind of gather their thoughts and send any questions.
Okay.
Well, it doesn't look like we have any questions. So I do also want to say that we will be sending out Cheyenne and Jamie's contact information via email. So you guys can reach out to them if you have specific questions to your situation. But again, thank you, Cheyenne and Jamie, for providing us this information today.
Well, thank you, Catherine, for inviting us. I really enjoyed being here. It was a new experience for us. We've been doing telecommuting for a few weeks now, and we're still getting used to video chat and whatnot. So thank you guys for your patience and for listening. And please definitely reach out to us if you guys have any questions. Have a great day and enjoy the rest of your day.
Thank you, everybody.
Great, thank you. Okay, so students, it looks like we have ended just a little bit early, so that gives us some time to have a longer lunch. Our next presentation is not until 12:30. I do just want to read this to you guys, the homework for session 2. A couple students had asked for these specific questions. So the 3 questions that you were required to answer was, what is the name of the school and where is it located? Is this school a college, vocational school, high school, or other? And what types of programs do they offer to benefit people with disabilities? You are welcome to send those to me again via email, send me a text message with a picture of them, or we can talk and you can provide me that information. Additionally, the school does not have to be in Nevada. So it can be anywhere within the United States, in another country, anything like that. We just need to gather some information on schools. I am also going to be pausing this meeting in the recording. It is not going to end the meeting. You are welcome to leave and return closer to 12:30, or you can pause your meeting as well. But I'm going to go ahead and pause it. Give you about 30 seconds. Does anyone have any questions? Okay, I see nobody unpausing or unmuting their microphones. So if you have questions, you all have my cell phone number, and I will see you in roughly an hour. Please try to re-add yourselves by 12:25 p.m. All right, everyone, we are gathered back. I do see that everyone is still on the call. We're going to go ahead and wait for our presenter. Oh, no, it does look like she is on here as well. And Joni, we'll go ahead and get started in just a minute or so. Do you want to go ahead and try the presentation?
I'm sorry, what?
Are you going to be using any presentation or anything?
No, I don't have anything. I'm sorry. I'm just going to talk at you guys.
No, not even necessary.
Okay.
I wanted to make sure if you had something that I gave you the chance to get that pulled up, but that's not necessary.
Okay.
We can go ahead and start whenever you are ready, Joni.
Okay, do you want to see my face or not?
That's up to you. If you don't want us to see your face, that is totally fine.
Okay, I'll put my face on for a little bit, but sometimes the computer freezes, you know, when I'm just like at the most inopportune time. So if that happens, I'm gonna like take my face off, okay?
That sounds great.
Okay, just one second. Well, it's not letting me. Okay, so my name is Joni Ingalls. I am the advocate for Washoe County with Northern Nevada Center for Independent Living. Although I like to say anybody that works there is an advocate for people with disabilities. I just happen to be Washoe County. And if there's any questions, just please interrupt me. It's fine. My screen's just, oh, look at that. Somebody put that up for me. Okay, so there's our website. Thank you, whoever did that. The center was founded here in Sparks more than 30 years ago. It was started by a small group of people with disabilities to help other people with disabilities hone the skills they need to achieve independent living. Over the years, the different programs have changed as the needs of the community has changed. I think when it first started, it was a lot of physical disabilities, people with physical disabilities, and had to do with access and mobility and transportation. And while I think those are still really big issues, we are seeing a lot more people since I've been there since 2009, people with developmental disabilities or mental, emotional disabilities. So it just kind of changes, and we try to be up for the changes, you know, at the center. I'm just talking at you. If I stutter and seem nervous, it's because I am. Okay. So as I said, I'm the main advocate. We also have a rural advocate. Our area is from Pahrump and the rest of Nevada all the way up. If somebody is in Pahrump and they give us a call, though, I do refer them to Southern Nevada Center for Independent Living. They're not going to come up to Reno for services, so it's kind of silly to say that we serve Pahrump. Our 5 core services are peer support, information and referral, individual and systems advocacy, independent living skills, and transition services for the older folks in nursing homes and for young people transitioning out of high school or out of secondary education. We also have some other programs that fit in with that, and that would be like our social and rec stuff. We have technical assistance. That would not be my area of expertise. We also have some emergency prep information for people with disabilities. We have a great blind and low vision life skills and peer support, just a whole program that we saw a need in the community a few years ago, and it wasn't really being met by the agency that had this big program. So we started one, and it's doing really good. It's something that I'm not involved in, as I am not the advocate that runs that. Mark Tatter is our advocate for that, but it's something that I'm just really proud of that the center is doing. So those are our programs. Nobody ever ages out. We help anybody from parents with kids on up to 110 or however long you're going to live. We don't discriminate. There may be some agencies that might better fit your needs than us. So I would always refer to somebody who's going to help you better than I might be able to. My passion as an advocate, I don't really know where it came from. It just has, and I can get really heated on others' behalves. So I like to teach self-advocacy, and some of the things in self-advocacy, if you don't know this, it's a lot of it is logic, or just, you know, being reasonable. But when you're angry or when you're fighting for something, sometimes it's easy for that to leave the room, or you just kind of forget about it because you are so passionate about something. But some of the tips that go along with self-advocating are: don't get mad. You don't have to do it alone. You can take a friend. You can call our center. I will go with people. I have sat in on IEP meetings. And when I go to IEP meetings, a lot of times I don't have to say a whole lot. I think it's just more of my presence, just being there and reassuring the parent or the high school student that, yeah, I'm on your side. I'm in your corner. What can I do for you? Are you sure you understood this? Is this what you want to do? You know, making sure that they know somebody's on their side. IEP meetings can be a little intimidating. So yeah, you don't have to self-advocate by yourself, especially if you're not used to doing it. Ask a friend, ask a relative that's in your corner. Call the Center for Independent Living, we'll help you. Also with self-advocacy, sometimes compromise is necessary. We don't always want to do it. We want it our way, but sometimes we have to take little victories. My dog is making noises in the background. I don't know if that's audible to you guys. So self-advocacy, it's always good to rehearse what you want to say and role play with somebody if you can. Practice is always recommended. It can be very, very nerve-wracking to self-advocate for yourself. So rehearsing really helps. Here's another one, fake it till you make it. Yes?
We actually have a question in the chat. How far east do your services go?
We would go all the way to Ely. Our rural advocate, if she cannot physically get to a spot, let's say Ely or Elko, which she can, but say the time-wise wasn't working, we can do like a Zoom meeting or the FaceTime thing. So we go all the way out to Ely or Elko. Okay, so back to self-advocacy. Fake it till you make it. That works really good. And sometimes you need to rehearse that because the person doesn't know what you don't know. So if you can go in with confidence and you've practiced, and maybe you don't know every single question they might ask you, but you're going to learn ways to stall the answer. And not necessarily, it's stalling, you know, just until you can get time and to get the right answer. And there's nothing wrong with that. Nobody says you have to be a walking, talking encyclopedia dictionary when you're trying to self-advocate for yourself. But find out what your strength is. Where are you strong at? Are you strong on the front lines? Are you strong talking to a legislator? Are you strong providing sandwiches for people who may be doing a sit-in or a march or just meeting up at the Capitol for a long day of legislating? So another thing, keep to the truth. Don't make things up. If you don't know something, it's okay to use a stalling tactic or to simply say, I don't know, I will find the answer for that and get back to you. But don't make things up because that's probably not going to end well. And when you start lying, it's really not good. It's just not good. Know your issues, stick to your issue. Sometimes it's easy to go off topic, but try to stick to your issue as much as you can. And as I said before, and this is the ending of this little part here, don't worry about having to know everything. Your passion and your support group and the people that are helping you and supporting you, they're going to get your back. They're going to have your back. You don't have to know everything, and it's okay to admit. Oh, there's a dog. It's okay to admit that you don't know everything. So really quick, a couple other tips with self-advocacy. Start with something small, but it's got to be something you care about, or you're probably not going to stick on it. So start with something small. When you're dealing with people, ask for their name, ask for their supervisor's name. If you're on the phone or if you're in person, write it down. There's nothing wrong for writing something down. In fact, I tell people all the time, if you have to make a call to an agency or whatever you're dealing with, write it down. Write down what was said, in a nutshell, unless you're proficient in shorthand. Write down the gist of it and the date and the time that you talked to the person. And that goes with keeping a diary of what you're doing. Use basic assertiveness, not rudeness. As I said before, sometimes it's really easy to let your passion get away with you. But you'll get more results with sugar than with not sugar. So use your manners, use your better words. I am known to have a potty mouth, but I know when it's appropriate to bring out that not so nice side of me. And that wouldn't be when I'm trying to get something done or something passed through legislation. So basic assertiveness skills, politeness to a good point. Good words, not naughty words. Don't call people names. Don't make it personal. The person you're going up against, it may be through no fault of their own that they have to hold that position. So that's some of my tips as far as being a self-advocate. Are there any questions as far as that goes? Okay. So let me, and I don't know if you guys are interested in this or not, but I'm just going to talk. How I got hired by the Center for Independent Living. I was out in Fallon, and I ran a subsidized apartment complex for 16 years. It was for people with disabilities or over the age of 62. And when that job ended after 16 years, I was basically a little burnt out. I found the Center for Independent Living, and they were hiring a rural advocate in Fallon. Worked there for a couple years, and due to financial constraints, we had to close that office, and I'm in Reno now. Grew up in Reno, so I'm glad to be back home. I'm also the housing advocate at the center, which right now is one of the toughest, most heartbreaking jobs I've had in a long, long time. It's something that I advocate for all the time. I don't know how many of you are in need of housing or on shaky housing grounds. It's very scary. One of the worst things that is happening is that property managers are asking people to make 2.5 to 3 times the rent. So if you only make $1,000 a month, you're not going to qualify for anything that, you're just not going to qualify. There are no $300 apartment places anywhere. Last year, or the last legislative session that met in Nevada, there were some good things passed as regards to housing. Not as much as I wanted, but I guess I guess we take what we can get. Oh, I see a question from Dora. If we're providing help to clients during COVID, yes, we are. We're all working from home, providing what we can. You can call the switch. You can call our main number at the office, and depending on what advocate or what services you need, you can just hit the extension. I have a burner phone here, so call me or email me. Email might be a little bit better, but if you can't email, yeah, call me. Leave me a message. I will get back to you within a day. We're trying to do some physical services for people for consumers during COVID. That's kind of hard getting off the ground, but we're trying. So if anybody needed to order groceries and pay for it with their funds, because unfortunately we don't have a lot of funds right now, we're waiting on some. But if they can order groceries and pay for it with their funds, I would do a curbside pickup for them and drop it off in the Reno-Sparks area. I'm sorry I can't hit all the rurals at this time, and I don't think our rural advocate, it's only one person, so I don't think she would be able to do that. But we're trying to offer as much as we can right now.
Joni, we
Yes.
also have a question in regards to the funding that was just allotted to independent centers. What do you guys plan on doing with that funding?
Well, we have talked about it, and we are still in a wait and see, and how much are we going to get? And what are the parameters? What can we use it for? So I know that I am not part of, we have a very small office. There's like 7 of us. So we pretty much know what's going on at all times. But being all separated in our homes, we don't have our little water cooler talks. And we really have not received the money yet. I think my boss, Lisa Bonney, is still working through the weeds and getting that all set up. So I really don't know. I wish I did. And I wish I could tell people, hey, we have some money coming and I'm going to get you some and we can help you. But I have to be very careful in what I'm telling people, which as an empath, an empath advocate, that pretty much hurts my soul. I wish I had a better answer. I'm sorry. I see a question from Dora again. What laws would I like to see passed in regards to housing? I would like to see a law that says a person does not have to make 2.5 to 3 times the rent to qualify. That's not a law. It's not a legislation. It's not a rule. It's just something that property managers do. See, I'm getting heated. I had called Silver State Fair Housing and asked about that because I thought it was discriminatory. And it's not discriminatory against people with low income or disabilities because they ask that of everybody, which is that's something I'd like to see a law passed that property managers could not require that. It's just ridiculous. You can have somebody who makes $5,000 a month. Doesn't mean that they are any more responsible than somebody that is able to pay the rent and with food stamp help and low energy income assistance could make the rent too. As I said, it just gets to me. So that would be one of the laws in housing.
Sorry.
No, you go ahead, please.
I have another question in regards of housing. I was thinking about for individuals with developmental disabilities and especially the homeless population. I mean, in regards to housing, I'm assuming that's hard.
Oh, it's terrible right now. I have consumers who are homeless and who do have developmental disabilities. I also have some with some mental health issues. It's horrible. And I have to tell them, hey, I'll get you on all these waiting lists and this is what we're going to do. But right now, today, you have to go back to the shelter. It's horrible. There's just not enough very low income housing built. We have what is called affordable housing, and I'm making air quotes around the word affordable. That's for people that might be at 50% of the median income. People on SSI, and if that is their only stream of money, they are at 19% of the median income. There is housing for the very low income, but the waiting lists are 1 year to 2 years long. And that's pretty much across the country. That's just not here in Nevada. I helped a person move. She needed to move out of Nevada, and she's a very low income SSI person. And there was nothing in Nevada at the time. And this was about 1.5 years ago. And I sent applications on her behalf to all of the USDA funded, not all of them, but most of them, USDA funded subsidized housing apartment complexes throughout the West, and even going as far as Minnesota. And they were all waitlisted properties, 1 to 2 years. Yeah, it's horrible.
I used to do housing too, so I know how hard it could be, especially finding resources for people with disabilities.
It is. It is. You know, I'll when I'm interviewing and I'm talking with a consumer, you know, it's like I ask the questions: is there anybody else you can get to roommate with you? Is there family support? Or, you know, maybe a person gets $1,200 a month, but here's an apartment and they want you to make $2,000 a month. Well, do you have a family member who could co-sign? Because that person might be able to, like I said, they could afford the rent. Let's say they make $1,300 a month and the rent's $900. They could afford that rent with some food stamps and low income energy assistance and food bank help and all, you know, others, and natural supports. But the rental company will not even consider it. So I'll ask the consumer, is there somebody that might be able to co-sign on your lease for you? Sometimes that's a solution, you know. But at the center, sorry. At the center.
Joni?
Yes?
Dora would like to know, do you know of any state that has those provisions in place regarding the affordable housing?
Oh, no, I don't. I think that capitalism has really I'm not getting all political. It's just capitalism. It's like, hey, we can do what we want. There, you know, doesn't matter. I guess, you know, the haves get to make all the rules. Let me get my dog a bone. Luke. So I do not know of any other states that would have that provision. Because as I said, I think, you know, just property managers, real estate developers, they get to make the rules right now, which is sad. Our homeless population is just growing by leaps and bounds everywhere with no regards to the people on the streets. And I just kind of feel it's another tinderbox that's waiting in this country, and it makes me sad. So our job at the center is to empower consumers, people with disabilities who come to us for help. And we do that a lot of different ways. I have people who come in and they're afraid to make the phone call to the landlord, the rent is late, or to call their social worker. Yeah, they're just kind of nervous, or maybe they're a voc rehab caseworker. They're just nervous about it. So I'll say, well, come in. We'll put it on speakerphone. I'll dial it up, and you can talk, and I'll be right there if you need me to help. But I try to remain quiet. This is the consumer's time, unless they signal at me or ask me to step in. I I like to see all people empowered and trying to do my best to help people get that, you know, to help people with disabilities get there. And I've said to consumers, you know, if I say something that is horrible or wrong, please correct me. It's okay. I just, because I want to do what's best for people that I work with or people that come to me for help. So if I'm not doing something right or if I've offended them, I want them to let me know and I would correct that behavior. So I hope that sounds good to the people I'm talking about, talking to right now. I mean, if your advocate said that to you, would that sound okay? Or would you think, oh my gosh, she's an idiot? So that's kind of about all I have. Kind of ended early. If there's any more questions, I'm here.
If you guys have questions, you can either send them through the chat or you can unmute yourself.
Can you go over the specific services you offer?
Oh, excuse me, the specific services?
Yeah.
Sure. Well, we have our 5 core, and that's something that all the Center for Independent Livings throughout the country have to have. And our 5 core are peer support, information and referral, individual and systems advocacy, independent living skills training, life skills, and transition. And transition would be for transitioning out of nursing homes or for transitioning out of the high school, out of post-secondary education. And in those core services, some of our programs are social and recreation. We have rec night twice a month. We also have cooking classes and some other life skills classes. Our life skills advocate is Patty Rodriguez, and she teaches Spanish. And we were doing sign language, but that's kind of hard with Zoom. So she is still, we also have a thing called the Pink Ladies. That is a women's only discussion group. Women with disabilities only discussion group. And these classes are on our calendar, and we are doing these classes and these groups online through Zoom. In fact, we did a bingo game the other day, and it was pretty fun. So that's part of social and rec. We also have some tech assistance. I don't really get into that too much because I'm about as tech savvy as a rock. We have an emergency preparedness program. One of my past coworkers put that together. I'm the housing person, yay. We also do a Voters Bill of Rights. And our newest and most exciting one is our blind and low vision and impaired vision group program. And there's peer support in there, and there's education and assistive technology and a lot of cool things. That's our stuff, yeah.
For individuals with disabilities and who are experiencing homelessness, do you guys help them in aiding them finding jobs?
We used to do an employment program in conjunction with Voc Rehab. We do not do that anymore. So I'll refer people over to Voc Rehab, and if they want me to go with them to the orientation or any case, or go with them to their meeting with their caseworker, I would certainly go along with them. But we don't do employment any longer.
Okay.
Yeah. And as far as housing goes, as much as possible, yeah. It's just, yeah.
Do you think shelters are less accessible? Like when you refer individuals with disabilities to your shelters and then they don't have accessible things for the shelters?
I think okay, so last summer, the lady that I helped move out, like I sent all the applications around, she finally moved to Nebraska, and then she came back. Stuff happened, and she came back last summer. And she's in a big power chair. and she was homeless because there's nothing. You just can't move to the state and move in somewhere. You have to, she was low income, SSI. You have to get on those waiting lists. So she was homeless for a good 2 months after she got here. She got here in May, so it wasn't too cold. And what was hard on her, I think, was being pushed out of the shelter every morning. She has a condition where the heat, where the extreme temperatures exacerbate that. So it was very hard on her. They are not very, the woman who was running the shelter here in Reno, over on Record Street, was not very kind. I went there to advocate on this lady's behalf. The lady also had a doctor's note asking if she could stay inside during the heat of the day. And they didn't want to honor that. So I went to the shelter to talk to her, and it was not a very good conversation. I would like to go and take a tour of that shelter, actually. I would like to go past the front door. I don't know how welcome I would be. I don't think they're very accommodating at all. Yeah.
Thank you.
You're welcome.
Is there any other questions for Joni? Dora would like to know, is the individual you are speaking of, is her name Casey?
No.
Okay. Okay, and as a reminder, everyone, I will send along the contact information for Joni. You can also find their information at nncil.org. Thank you so much, Joni, for taking your time out of your Saturday to be here with us. We really appreciate it.
Oh, thank you so much. It was really good listening in. I'm probably going to just mute me and just leave the computer on as I'm kind of putzing around. And thank you for pushing out my contact info. I'm sorry I didn't have anything to put up on the screen, and I really appreciate you doing that.
No apologies necessary. We'll send it out and everyone can connect with you for their own personal needs as well.
All right. Thank you, everyone. Stay safe and stay healthy.
Thank you. All right, students, we don't have our next speaker until 1:15. So if you want to take a quick break, stretch your legs, use the restroom, get something to eat if you need to, we will reconvene at 1:15. I'm not closing down the meeting. I will just mute this line. If you need me, please use the chat or call my cell phone. Okay, so we're gonna go ahead and get started again so we can stay on schedule. I see we have Vicki Ives with us. She's gonna be presenting next. Vicki, can you hear me?
I can. Thank you, Catherine. It's nice to hear your voice.
Yes, you as well. And just to preface this, Vicki Ives is also one of our council members. She works for the state at Maternal and Child Health. I will allow her to introduce herself and go ahead and get started.
Wonderful. Thank you so much, Catherine. And I don't know about screen sharing, maybe to bring up the presentation.
Would you prefer that I do it? Or if you click on the bottom half of your screen, there should be a little green button in the middle that says share.
Perfect.
Perfect.
Let's see if you guys can see it here. Does that come through okay?
Yes, it does.
Oh, excellent. Thank you. Well, thank you all. It's such an honor to be able to get the chance to meet you all today and share a little information about some of the programs that we have at the Maternal, Child, and Adolescent Health section. As Catherine said, my name's Vicki, and I'm the section manager at the Division of Public and Behavioral Health for the Maternal, Child, and Adolescent Health section. And within our section, we have numerous grants. We're mostly federally funded. We apply for grants to do specific activities supporting those key populations. And one of those grants within the section is the Title V Maternal and Child Health Grant. So I'll talk a little bit about that grant and some of the programs within that, some of our resources. One key family resource that we've spent a lot of energy trying to promote utilization of, and just see if there's any questions that you all have that I might be able to provide some information or connect you to resources. So if you have stop me at any time, or if any questions come up, please feel free. So just real quick, I'm not sure how familiar just in terms of our state structure, but the Division of Public and Behavioral Health sits within the Department of Health and Human Services, just like Aging and Disability Services, or welfare, or where Medicaid is situated. So there are a number of divisions underneath the Department of Health and Human Services, and we really focus on public health within that within our division. And within the division, there's lots of different programs and bureaus and sections, and the one I'm in just works with maternal, child, and adolescent health and its focus. So some of the grants within our budget that we administer, some deal with teen pregnancy prevention, some are maternal and infant health focused. We have our children and youth with special health care needs program. We have 2 pieces of newborn screening within our section: our early hearing detection and intervention newborn hearing screen, as well as the critical congenital heart disease registry. All the other parts, like the blood spot test for the genetic screening, that really is through UNR and the state lab, the University of Nevada State Lab. But we work in close partnership with them, with our smaller components for just the critical congenital heart disease and the early hearing detection and intervention. Early hearing detection and intervention works really closely with family partners like Hands and Voices and deaf centers to really identify children who happen to be, or infants who happen to be deaf or hard of hearing, and connecting them through referrals and screening, connecting them to resources. They work really closely with early intervention services, it just have some really strong funded relationships with specific organizations supporting families with children who happen to be deaf or hard of hearing. the critical congenital heart disease is a little newer, and it's really focuses on just identifying the children with those problems, and we hope to grow it into something more like the early hearing detection as funding gets released that we can apply for to support a bigger system around that. But right now, just getting a sense of how many we have impacted by critical congenital heart disease with our newborns is where that particular program is. We also have our Nevada Home Visiting Program, which works with pregnant moms through kids up to age 5, depending on which model, and you know, any family of a whole variety of different needs and in need of different supports, and they really focus on. It's a voluntary program that's focused on just connecting people to services. There's a lot of working with screening, parenting. There's kind of peer teaching models within some of the systems. Others, there's a variety of different programs, but it's a real nice partnership around promoting, you know, child health and infant health and health during pregnancy with some of those programs. Statewide, it's a small program, but it really makes a big impact on the families who you know, work with that program. We do some work with large scale surveys to find out about what parents are doing during pregnancy and early infancy, our PRAM survey. We have a rape prevention and education program, and some other smaller programs within our section. But just as a quick overview, but what I'll be talking about is really this Title V maternal and child health program, which is one of our programs here. And within that program, oh gosh, I have to advance, pardon me, I'm figuring this out here. I have to advance the slides in the original, I think, if you all don't mind. Were you able to see the slide change? Did that work okay?
Yes.
Great, thank you. So within this maternal and child health Title V block grant, there's a federal requirement that 30% of the funds that with that grant serve, this is how they define it, children and youth with special health care needs. So within our maternal and child health program, there's a specific coordinator who is dedicated to children and youth with special health care needs in terms of her focus, and that's Larissa White, and I put her contact information at the end of the presentation as well. And myself, I serve as the director of our children and youth with special health care needs. And the way that the federal funder, who's the Health Resources and Services Administration, defines special health care needs, it's super broad. It's really just any you know, over the age of 1, any child with a need greater than the average need. So it could be you know, behavioral health related, mental health, you know, a specific disability. It's super broad. So it's really, we look at it from birth to age 21, but the federal funding really cuts it at one years old. So there's a little disconnect there. We like to think of it as a full continuum. And it's just important to know we do not do direct services with this funding. This is really all aimed at passing money through us out into the community to fund different either systems building or referral networks, connecting people to services, not paying for the services themselves, and is how this funding works within Nevada. And that there are other programs within this Title V maternal child health. We have our maternal and infant program, our adolescent health and wellness. We have a maternal child health epidemiologist. We have a manager that works with that program, and all of our programs really work closely with each other. So But this children and youth with special health care needs is a specific program within that grant. So some of the community programs where we're really focused on just, well, identifying gaps in services, linkages to enabling and population health level resources as opposed to individual is the focus of this particular award. We work really closely with the local Family Voices affiliate, and that's a really grant required partner working with Family Ties of Nevada, and they have services both in the north and the south. We'll talk about that a little bit more in a minute. We have a lot of efforts going into promotion of this medical home portal, and just anything that really supports, integrated care within a medical home, a pediatric medical home, is a real priority for this particular program. So Mary Meeker is our Title V Maternal and Child Health Family Representative for this grant. And we receive funds and then pass them through to the Family Ties to do things like support this bilingual helpline with the numbers on the screen below, as well as the website for Family Ties. They're really funded to help just provide family support and care coordination in both northern and southern Nevada. There's a bilingual helpline that supports children and youth with special health care needs and their families. They provide interpreter services. We've worked with them for years to provide support for the craniofacial clinic at UNR for families that need interpretive services. They work with our medical home portal, with Nevada 211. They promote different services. They work closely with the Nevada Early Intervention Services. So that's one of our partners within this program. We also have traditionally, we've worked for a long time with the craniofacial clinic, with UNR's UCAN program. We have some longstanding support of developmental screenings and milestone moments, distribution, statewide to really help folks identify developmental delays and get them referrals to services for further screening. So whether by the milestone moments, booklets that we fund for printing distribution and helping parents utilize those. Ages and Stages questionnaire, which is also a developmental screen that is parent completed. That's another area of partnership with them. And we really want to expand some of the transition work coming up in the next state fiscal year of transition supports, and that's early transition. After early intervention services age out to when the school system engagement really kicks in, as well as for our young adults and adolescents, for all children, those with children and youth with special health care needs, and those without. So that's really an area that we're looking to grow resources in.
Vicki, we have a question from our students. She would like to know, in regards to grants, since your program funds those programs, do you have oversight on the grants, and how does that work?
Yes, I'm the section manager. We do our planning in 5-year cycles. We just completed statewide outreach on our needs assessment to set our priorities, looking at data from places like the National Survey of Children's Health, which has data on children and youth with special health care needs, as well as numerous state and federal sources. So we look at the data, we look at needs, we look at infant mortality, maternal mortality, transition, pediatric medical home, preterm birth outcomes. It's really wide in the scope of this particular grant of all the populations who need served, because it's pregnant women, infants, children and youth with special health care needs, adolescents, children throughout their age span. So we have some key populations of service. So we have longstanding, partners that are supporting what the outcome of the last 5-year needs assessment are who's currently funded. And then the results of the needs assessment we just completed, plus the data that we get on, areas of need, whether it's, adolescent suicide, or it's very, very broad in its scope. And that determines where our funding goes, the data, and then the needs assessment. We do a 5-year action plan and then all of our activities that promote enabling services and population health level services, not direct services, but if that's helpful context.
Perfect. Thank you so much.
Sure thing.
Vicki, I do just want to let you know that the microphone on your computer, unless you are looking at your screen, it does cut away.
Oh, okay. Thank you. I'm sorry. This is an older laptop. I'll get closer to it. Thank you. Thanks for the heads up on that. Great. So those are just some of the partners with that particular program. One of the efforts that we've really tried to promote utilization of is this Nevada Children's Medical Home Portal, and it's a web-based resource. It's vetted information. We work in partnership with the University of Utah. All medical content is by a panel of experts from their medical school. So the professors within their School of Medicine and consultants. So it's reliable information on a variety of topics, not just biomedical, but social supports, resource referrals, linkages to services, both at the national level and then, more importantly, Nevada specific, or equally important, I shouldn't say more importantly. But the whole premise of this is to have kind of a one-stop shop for parents, families, and providers on just resources that are available for a whole range of different conditions, needs, housing needs, as was spoken about earlier, where are the local food banks, respite care, just trying to aggregate a whole bunch of resources. And we work closely with Nevada 211. Every quarter we get a download of all the new partners that have come on to 211. We go through it, find those that are supportive of youth, families, children, and make sure that they are imported into this medical home portal. But it's really, really focused on our populations of service. And there's a pathway too, if you have a small, brand new nonprofit that you want to get on the portal, there's a pathway to submit partners as well within the portal to add. So it's not, sometimes some of these large ones like 11, just some of the smaller ones don't always, it can be a little harder to find sometimes. So this portal helps with that. So an example on how to use it. This particular one is just hypothetically, someone's son was recently diagnosed with autism, and how you'd find out reliable information about the diagnosis, plans for future schooling, supports for siblings, that type of information within this Nevada Medical Home Portal. And the address is below here, this nv.medicalhomeportal.org. And then just some kind of screenshots to just show you a little bit. It's really, user-friendly. You would select the drop down on the language, so you can you have some, you can take it to whatever language is your language of preference. And then there are multiple states that engage in this same medical home portal, but if you click on Nevada, it'll populate with the Nevada resources. And then you just have these main headers here: diagnoses and conditions, newborn disorders, caring and advocating for children and youth, so either from the parent and family lens or for physicians and other professionals. And then there's the Nevada Services Directory, and then some additional resources. So this concept of the medical home portal is really just trying to get away from silos, trying to integrate. It really started with integrating, medical, biomedical care with, behavioral health and mental health, that you should try and serve the whole person's needs, social needs that you might have, that, oftentimes you need help with those before you can really sometimes dig into some of the other, specific diagnosis, for example. So just going through with this one particular, go ahead.
And is this website accessible for those with visual impairments?
Sorry, it isn't. I heard the word accessible. It is an accessible website, but you cut off a little bit at the end after accessible.
That was the question. Is it accessible for those with visual impairments?
It's ADA compliant, so yes, it is. They have made it. Any resource that they onboard, they go through that process.
Perfect.
But I'll confirm specific to visually impaired. I know it meets the ADA compliance, so it would need to. But I'll double check the functionality on that for sure.
And then we have one more question. What are the protocols surrounding children's mental health? Unfortunately, the student came in a little late, so she said if you already talked about it, but she would like to know that.
Protocols, and I'm not sure on the question. There's information within the portal that's specific to mental health, but I guess I'm not sure about the protocols. If you don't mind giving me a little more information about what you're interested in on the mental health piece.
I will ask the student to just provide a little bit more information, and then we can come right back to it when we do that.
Oh, great, thank you. So this is just an example. If someone was going in, if I was going in to look for some information for my child, I'd go to the parents and families, and then the arrows just highlight some key areas over on the left side of how do you find quality information, either before a diagnosis or after a diagnosis, a problem is identified, some resources there. Break up depending on the age of the youth themselves that is utilizing this, or if the family is. So in this particular case, that example is a 2-year-old looking at these early services that are available for the 0 to 5 age. And then you can see just some of the different topics about navigating transitions. There's a assistive technology section, taking care of yourself as a caregiver and your family, or as a youth or adolescent yourself with a healthcare need. There's some questions about legality. There's a really quick diagnoses and conditions FAQ piece. We've gotten feedbacks, especially from our families with more difficult to find information, and Nevada has really medically underserved in terms of our ratio of providers to population. We have many more clients to physician ratios, it's higher for us than in other states. So sometimes, you know, for seeking specialty care, we get feedback, especially for those with more rare conditions, that the information on the portal gave them information that they weren't able to get from, you know, their home provider in some cases. So they really try to always add, you know, quality content to this. There is a mental health drop down there as well. There's some personal, you know, stories, and then there's some funding around need. So there's really great resources on, say, the Katie Beckett waiver, which is a pathway to Medicaid for families that might be over the federal poverty level requirements under certain circumstances. And Family Ties, who we fund a part of someone at PEP as well, but that's specific to developmental screenings and the taxi program. But there are folks that can help navigate these processes. But this is a place where you could learn, you know, learn about those different programs and touch points that with different ages, because it can be so complex and siloed. So, for example, just going on one of those sidebar tabs for finding quality information, and then going into if the focus was, you know, maybe more on health information. You can see there's specific resources that are targeted more at healthcare folks or at care coordinators, linking parents to each other, and then disability, you know, organizations as well. So just given.
So we got some questions.
Okay.
So specifically referring to, can your grants or can your program technically serve children with mental health?
Well, we don't directly serve, we don't provide direct services at all. It's all referral, systems building, population level health, not individual. So we don't fund specific services for children. We would fund a partner or something like this portal, so that would help people connect to those that give services. But we don't fund any direct services. That's not the intent of this grant. It's really more about enabling people to connect with those that give direct services, if that helps.
And correct me if I'm wrong, but are your grants specifically for startup projects that can self-sustain, or do you stay with these programs throughout the lifetime of, like, Nevada 211? Do you continue to check up on them past the funding that you provided?
We have some pilots, like one of our pilots that we've been nationally recognized for is our funding partnership with Urban Lotus. So they are working with providing you know, mindfulness supports and physical activity to foster involved youth, youth in detention facilities, you know, youth in inpatient behavioral health facilities, just vulnerable youth at high risk. And that was a pilot. That's a small pilot that we will help grow along, but we always build in language in our sub-awards that we expect anyone we're funding to be looking at sustainability and finding additional funds. The only partner that would be definitely always ongoing would be the Family Voices affiliate with this particular funding, because that's just a partnership within the grant condition of the grant. So some of them are short-term pilots, some of them are longer term. We work in these five-year periods on specific issues. But yes, Catherine, that's, you know, our goal is to, you know, incubate, get things started, as well as there's some things like preventing unsafe sleep environments. That's been an ongoing one, or substance use in pregnancy. So some of these really long-standing areas of concern, we'd anticipate continuing efforts in those areas, independent of the 5-year plan, just because we see the outcomes of those not getting necessarily better, and we want to work on that. So
Great, thank you.
thank you. So just moving through here, just to kind of show some of the functionality of it. So within this, for parents and families, if Jane had gone into diagnoses and conditions FAQs, dropped down and picked autism spectrum disorder, there's a diagnosis module, there's links to early intervention part C, goes through introduction, what it is, what causes it, symptoms, and then you can get more into specific information, supports, resources, providers who work with families and individuals living with autism, as an example. And then this is just showing as it gets more into, this is digging more deeply into some of the sidebars underneath this FAQ section that you can get into more detailed information. There's this tab, again, you'll see on the left in the blue box, services for clients and families, and different drop downs and linkages around areas of possible interest for families or youth themselves, and linkages. And these are older screenshots. We're always trying to update this. And then so these numbers reflect when this was first launched, and it wasn't populated that much in terms of the number of behavioral specialists. But you can see if that was their interest, they had clicked on that tab on the prior screen, you could go by location and look at different services available depending on what you picked. Because this is a 2-year-old, if they were to go into these early services, it just breaks out. It can be pretty challenging, the early intervention, and what's part C and what's part D, and what's a individualized education plan, and what are resources and advocacy, related to those. So it just aggregates a lot of information in one spot. And then resources and, information and supports for parents and patients. They also have a provider, focused view within this as well. It has a way you can save if you wanted to keep notes on certain, save certain key, kind of like bookmarking within this, or you can create your own sort of notes section within this to utilize if you found that useful. And then again, just some other examples of how you could dig into, here's general information about what is Part C, because it's a 2-year-old, and then looking at the early intervention program, linking to specific service providers. So those are just some examples. We do have, I don't know if I can switch. I'll wait to do that at the end. We have a lot of just targeted more at little guys, really, younger families with younger children. We have some just promotional things like little teddy bears or sippy cups or different things that are branded with this. If you're ever giving a talk or going to an event and would like some, they're at no charge. We'll ship them to folks for just promoting this portal, awareness of the portal. The other recent partnerships with this Children and Youth with Special Healthcare Need program is working with our rape prevention and education program. We fund we help fund a lot of folks fund the Nevada Coalition to End Domestic and Sexual Violence. And one of the activities we asked them to move forward, and they've done a really nice job of creating resources to prevent sexual assault among those young people with developmental disabilities. Any really just to try to decrease sexual assault and increase awareness of a population, that has risks, and have some targeted information and education. So they have been providing trainings and developed resources with the funding through the Rape Prevention of Education, and working with folks like the DD Council, with our Children and Youth with Special Health Care Needs Coordinator, with the Rape Prevention Program Coordinator, and statewide specialists to create content and fund those courses. And Judy Henderson's been a real key person that's developed resources there. Our adolescent health and wellness programs also partnered with our Children and Youth program and Family Ties to just share information around adaptive physical activity resources, a list of accessible parks and adaptive equipment within Nevada, and those links are on the slides. Just so folks have it with COVID, we're really at the state level are really trying to funnel information to this Nevada Health Response.nv.gov as the prime site to keep quality content around COVID all in one spot. There's also the essential services link, and then there's a COVID specific section within the medical home portal. NDE has some resources, Nevada Department of Education too, that are specific to, working with, they have, I'm sorry, I'm looking at the title so I give you the right supplemental fact sheet addressing the risk of COVID-19 in preschool, elementary, and secondary schools, as well as questions and answers on providing services to children with disabilities during the coronavirus disease pandemic. So they're just different resources. This Nevada Health Response is really the key area that the Department of Health and Human Services are sending folks. And then this is our program coordinator, Larissa White, and her contact information. My contact information is part of the invite, and we're both always happy to help connect resources, share information. If you're applying for a grant and you want a letter of support, I mean, we have to get that kind of thing approved through our chain, but still, we're always happy to explore that. We have a website, the Division of Public and Behavioral Health, that's specific to children and youth with special health care needs program. And with that, if there's any questions or anything I can elaborate on, I'd be happy to.
Just as a reminder, everyone, you can unmute your line or ask the questions in the group chat. I'll give it just a few seconds to see if anybody has any questions.
I just wanted to make a statement that I didn't know about the website, the Nevada Medical Home Portal. So it has some good resources there. I didn't know about that.
Thank you for that feedback. Thank you.
I also want to make a comment. This is Catherine Nielsen. There is a lot of, I guess, some pushback on Nevada 211, and there's a lot of people who provide medical home portal, and I do want to say that despite some of the issues with the website, it contains a plethora of information. It is a lot of people have spent a lot of time putting this website together. So if you have feedback on the website as well, I've been told that they welcome that input, but please use this portal and please send the information along to anybody that you think would benefit from this information.
Oh, thank you, Catherine. And yes, we've been partnering with 211, and they have made there's a lot of effort there, like you said, and a lot of improvements, and they're really receptive. The portal's really receptive. There's a way to give feedback and comments. So both are really great resources. And really the point of this is really to consolidate it more for a family and for a specific population. We fund trainings with 211 so that if someone who's pregnant calls, that they get referred to the right areas. So they're definitely a key partner in the portal too. So yeah, any help in spreading the word, or if you're speaking or at an event, and some of the handouts for this or would be useful, or for any of our programs, please feel free to reach out to me, and I'm happy to help.
Thank you so much, Vicki, for taking the time out on a Saturday to come and speak to this class. And we appreciate your time and everything as well. And additionally, class, I will re-forward Vicki's contact information and Larissa White's contact information with the content of this presentation. So please reach out to either of those two individuals. They are both a plethora of information and have a lot of great resources for you.
Well, thank you so much for the opportunity and for everybody's time. I really appreciate it. Thank you.
Thank you, Vicki. Okay, class, so we are on another break right now. I want to remind you that if you have not done your research for the school, please do so now, and send me that email for the information. If you would like to send an email, you can, again, text me a picture of it or give me a call to provide that information. We'll take about a 15-minute break. They'll allow the few individuals that need the time to do that, to complete that request, and then please call me or text me if you need anything. We are reconvening with a presentation from the United Cerebral Palsy of Reno at 2:15. That gives you approximately 15 minutes. Thank you. If you want to go ahead and share your screen, do you have materials that you'd like to use today?
No, I don't have any materials. I was just gonna kind of talk.
No problem. I'll pull up your guys' website so they can see what UCP is about while you talk.
Okay. So just a little introduction. My name is Michelle. I'm the program director for UCP of Nevada. So what we do is we serve individuals age 18 and up with disabilities, any kind of disability, and we provide job training and also a day hab. So you can either work and get some skills for the community, or you can just go for something meaningful to add to your day. We have a lot of outings that our individuals go on. So like once a month, we'll try to go to the planetarium. We'll go to the library every week. We go bowling, we go on lunch outings, and that's just to kind of get some skills in the community, such as money management. We offer a lot of classes as well during the day. such as money management, reading and writing, arts and crafts. So we do kind of a split between some fun classes and then vocational training courses. We also have job coaches who work in the community with clients to help them obtain competitive employment. Right now, we have job coaches who are working with individuals at Goodwill and Walmart just to help train and get them ready for competitive employment. Other than that, we do a lot of arts and crafts. We have an advocacy team. We have a safety committee, just a lot of fun stuff that we do.
Michelle, I'm not sure what happened, but we lost audio on you.
Oh, can you hear me now?
Yes.
Okay, I don't know where it cut off.
About 15 seconds ago.
Oh, okay. So basically, that's just kind of a rundown on the services we offer. We also have Project Search that happens at in the community. Last year we did at Renaissance. This year is at the Atlantis, and that's adolescents age 18 to 24. They are interns learning job skills on site, and usually, so it's a school year, and at the end of the year, they usually are offered employment, and if not through the actual casino, they have those skills and they'll work with a job coach to obtain employment since they've had all this training. So far at the Atlantis, 4 of our interns have been hired this year, so that's super exciting. And then over summers, we usually have Thrive Camp. It's conductive education camp. So it's for children, and they work with an educator, kind of helping support children with neuro disorders, and then also provide training to their parents of things that they can do at home to just kind of provide support and education. And that's really a lot of what we're working on right now.
I think we might have lost you again there, Michelle.
Oh, I stopped talking.
Okay, perfect.
I don't know, is there anything else you'd like to know or any questions?
Yeah, for your intern, is it anybody of any age starting from high school?
Yeah, so our team members are 18 and up.
Thank you.
Michelle, can you talk a little bit about the A-team and how you guys host their meetings?
Yeah, so we have our A-team, and that's an advocacy team that we have. So that's just for everyone who wants to join, who's a part of UCP, a lot of our team members. And we'll just kind of keep track of current events, especially laws regarding disability. And our last big thing that we did was last year, our A-team went to Carson City and helped speak out about in support of the sub-minimum wage, because a lot of our individuals really like that. So they really just get together and talk about things that are important to them. So and it can vary. It's a big skill that a lot of our individuals like to learn, and it's really empowering for them to make sure their voice is heard. And so we'll do meetings of that at least once a month, but we try for twice a month too.
Great. Do we have any other questions for Michelle? As a reminder, you can send them through chat, or you'll need to unmute yourself to ask. No, well, thank you so much, Michelle, for coming in and presenting to us today. We appreciate you taking your time out of your Saturday.
Of course.
I will be sending out Michelle's contact information to you. So if you have any other questions, you can reach her and connect with her directly.
Sounds great. Thanks, everyone.
Thanks, Michelle. Okay, so since we have a little bit of time before our next presenter, I definitely don't want to take another break. But I'm going to utilize this time to help us get a little bit caught up on our project. I have had our one-on-one conversations with each of you so far, and you guys have had some pretty detailed information provided to you on our 2030 vision boards. I want to remind everyone that these will be due session 7, which is our July class as of right now. Should anything change because of COVID, we will update you. You can work on these throughout this time. Please make sure you are keeping track of the time that you have spent on these as well. In regards to your time tracking, if you could send me a brief email with the amount of time you've spent, the date, and what you've been working on. That way we can still have the backup for your partners in policy making requirements and your hours. This includes the amount of hours that you are working on your 2030 vision boards. As of right now, you will not have homework for this class for the April session 4 class due to the amount of time it will take you to work on these 2030 vision boards, the one-on-one conversations we've been having, the flexibility that we need right now due to COVID and all of that. As a reminder, you do have to complete all 5 sessions or all 5 online courses by August 15th, which is our last class. You can complete them in whatever order you would like to complete them in, as long as you complete all 5 of them by August 15th. Please continue to send me any updates on your courses, on your project, on your hours and such. This will allow me to keep track of all of your hours and let you know if you need additional hours or if you are keeping on schedule with the amount of hours you are required. We did reach out to the national partners in policymaking folks that run all of this and keep track of their graduates. And we do still have to get to as close as we can to the 128-hour mark. Unfortunately, there has been some other councils or organizations that have put on the partners in policy making without getting to 128 hours, and this is not sufficient enough for the national partners in policy making folks. So we do have to still get to the 128 hours. If you are noticing that you are not spending as much time on your projects or on your online courses to get you to that amount, please reach out to me. Due to some of the flexibility that the national partners folks have, we can add hours to your online course if it did not take you as long as you are supposed to take. They have the amount of hours that this course is expected to take, and that is the minimum hours you will get credit for. So if it took you longer, you will still get the amount that you spent. As it has been. If you are required to have a PCA for support for these classes, please let me know via email and we will still send out the reimbursement for that. We need the date, how much time they spent providing you some assistance, and what project did they assist you on. We also need to know where to send the payment. If for some reason they are not one of the PCAs you had listed prior, please let me know. We'll send you out the W-9 as well that you are required to fill out before we can send out any payments. If you also are required to have respite during this time, I know that this is a kind of weird situation where you may or may not be able to allow your child to go somewhere else because of the COVID-19. However, if you personally have somebody else watching your child and you are paying for it, please let us know, because we will still cover respite during this time. We obviously are not covering meals or mileage, but we will still provide all other services. In addition to that, if you have any costs for this class as far as materials or anything and you would like to be reimbursed for them, please send us a receipt. I will submit those through Carrie to get payments for those as well. And then if you need assistance, please always know that my cell phone number has been in several emails, but I'll continue to send those to you guys. But please be mindful of the time and day of which you're contacting me. 7 o'clock on a Sunday, I am spending time with my family. So if it is not urgent or an emergency, please let that wait until Monday or send me an email. I am in and out of the office at this time, so my cell phone or email is the best way to reach me. Does anybody have any input on their chosen 2030 vision project?
Yeah, for my project, I wanted to specifically, I was thinking about, for my vision, it's on housing and stuff, because that's really an issue for me.
I'm sorry, Stacy, you broke up there at the end. What was your question?
For my vision for that, for my 2020 vision, but it's I'm thinking about doing it on like the impact of housing on people with disabilities.
Wonderful. I really like that idea, because most of you are probably familiar with the fact that housing impacts most people with disabilities. So I think that's a great idea. Is there any other input on the 2030 vision? Okay, so we have vocational rehab coming up next. Vivian Turner is one of our council members. I know we also have a vocational rehab employee in our class. I will have Vivian Turner provide her presentation. However, Allison, if you'd like to provide any input at the end of the presentation, I would welcome that as well. So again, as a reminder, I see Dora joined us. We do not have any homework this class. You are required to complete all 5 online courses by the last class in August 15th. So we just encourage you to continue to plug away on that. I'm going to go ahead and give us a little bit of a break. However, as soon as I see Vivian Turner join us, we're going to go ahead and get started. Hopefully we can end a little bit early today. So I would encourage you guys to not leave the classroom and keep your volume up so you know when Vivian enters the classroom and we can return and get started. As always, please message me, text me, call me if you have any questions. Yes, we can.
Oh, cool. Well, I'm just going to talk. So vocational rehabilitation, in a nutshell, what we do is we help people with disabilities to find work. We're actually celebrating 100 years of vocational rehabilitation this year. Back in 1917, they found that veterans returning from World War I who had been disabled, oh, Vivian's here.
Yes, she is.
Okay.
If you want to continue, Allison.
Keep going? Okay.
Just briefly tell us what you do at Voc Rehab.
Okay, so don't do the history lesson. Got it. I am a certified rehabilitation counselor. I have a master's degree in rehabilitation counseling. And so what I do is I help people with disabilities to find work. And that's what I do.
Great, thank you. And if for some reason there's anything that you feel you want to add on to Vivian's presentation, I would welcome those comments at the end as well. So
cool.
But I think we're just waiting for Vivian's final connection to audio. Vivian, can you hear us?
That looks like the back of a computer monitor.
Vivian, if you are connected via VPN, please be mindful that it's going to connect to the camera that you have in your office. As a way around that, I can quickly shoot over in the text the phone number that you can call into. You can use that for your audio as well. There we go. Vivian, can you hear us now? No, I do believe it is connecting to the computer audio within your office. Let me still shoot over that phone number for you to connect. My apologies, everyone. For some reason, when you VPN through the state, it connects to your computer in your office, so you are seeing and hearing inside your office if you are connected via VPN. We're going to give Vivian just a few minutes to call in to get. And Vivian, I have put that phone number inside of the chat if you're able to see.
Hello?
Hi, Vivian, we can hear you.
Okay, great. I'm having some technical difficulties with my video.
I think you are connecting to your VPN, is that correct?
Yes. Oh, you are correct. I am in that. Yes, I am. So that's why it's showing at my office. I'm not at my office.
So would you like me to just pull up your screen? You can let me know when to advance the slide.
Yes, let me get that up first. Okay. And okay, it is up.
Great. Can everyone see this here? Wonderful. Everyone can see it. So if you'd like to get started.
Okay, I can go ahead and get started.
Yes, I
Can
apologize. My
everyone hear?
mute is hard to get to. Go ahead and get started, and just let me know when to change slides for you.
Oh, okay, great. Thank you. Okay, so my name is Vivian Turner, and I am a vocational rehabilitation supervisor with the Bureau of Vocational Rehabilitation in Las Vegas. This presentation is basically just to give you a little overview of Voc Rehab and the services that we provide for individuals with intellectual disabilities. This is the presentation, and the title of it is At Work for Disability Inclusion. So you can go ahead and do the next slide. Okay, so at Voc Rehab, our job is to help you to get a job. So what we do is we provide services that will hopefully help to empower the individual to be able to advocate for themselves. We just provide support. We advocate, we provide supports, and whatever assistance is necessary for that particular individual to become employed. Next slide. So some of the services that we provide, we have an assessment of job-related skills and abilities. We assist with job search, job placement, and job retention. We also provide any type of restoration services, especially if it's necessary to determine what the actual disabling condition is, or even to help someone to begin to receive supports in order to decrease the barriers to employment. And then also, of course, career counseling and guidance. Let me do the next slide. We also serve individuals who are deaf or hard of hearing. Services for the blind and visually impaired, education, training, and skills enhancement, and we collaborate with employers to provide assistive technology for the workplace. In the next slide. We also have transition services for high school students. So our transition services are a little bit different because we have counselors who are assigned to certain schools in the Clark County area and also in the Northern District of North Nevada, who are assigned to certain high schools to provide services right there at the high school. So trying to collaborate with the transition teachers and helping individuals to learn about Voc Rehab and get started as they're transitioning from high school into adult life. Another service for individuals with intellectual disabilities, our most significant disabled individuals, are supported employment and customized employment. Now go to the next slide. So we're going to talk a little bit about supported employment right now. Click the next one. So supported employment is based on the principle that individuals with severe disabilities have the right to be employed by community businesses where they can earn comparable wages and work side by side with coworkers with or without disabilities to experience the same benefits as other employees of the company. The Bureau of Vocational Rehabilitation, we partner with Desert Regional Center and other employment networks to provide the services and supports for individuals that are interested in obtaining employment through support employment process. So in our partnership with Desert Regional Center, that allows individuals who are receiving those support services to have that extra support. So someone can always apply for services to Voc Rehab independently, and they don't have to have an open case with the regional center, but it's very beneficial if they do, because the regional center can help to provide supports for that person once their case is closed, successfully employed with Voc Rehab. And we'll get into that a little bit later in the presentation. So I'll go to the next slide. The process for supported employment. So what supported employment is just a program that actually allows for that individual to receive the supports that they need to obtain and maintain employment. So someone may not be able to independently go and fill an application out and interview for a job. So with the supported employment program does is that it provides those supports. And so that's what that job developer, your voc rehab counselor, a job coach, those are supports that are there to help that individual to, first of all, recognize and identify certain skills, abilities, and interests that can be related towards employment, and then actually finding those jobs. In the process for voc rehab, that support employment process, we also engage that person in different type of work assessments or vocational interest assessments. And that's just to help to determine what their actual work skills are, what supports are needed once they obtain employment, and then creating an individualized plan to provide those supports for them to be able to get their job and keep their jobs. And do the next slide. So just in defining some of these supports, as I did before, so the job development, that's assistance with job search and applying for jobs. So a job developer is someone that actually works with that individual. So if someone identifies that they want to work at certain places, but they have challenges with filling applications out either online or by paper, that job developer will fill those applications out for that person, and then do the follow-up, also advocating to for that person to at least get an interview and an opportunity to show their skills so that they can be considered for employment. That job developer goes out and searches for jobs, so they're going to be knocking on doors, they're going to be filling out applications, and they're working with the individual in this process. So maybe the individual is also doing that, but maybe they cannot actually fill those applications out, but they can tell their job developer, hey, I saw a place where they have an opening, can you please put an application in for me? And so that's how the job developer and the individual are able to work together, so that it's still that person very involved in their own job search. The job coach is someone who, after that person has been hired and they are actually working, then that job coach is going to come along and provide one-on-one coaching and support for that person to learn their job duties. So if someone gets employed, and usually a manager or a supervisor, they will do an initial, showing them what they need to do, but maybe that person requires a little more one-on-one assistance or a little longer training. That's what that coach is for. That coach is there just to support, to provide whatever training is necessary until that person has learned to do their job and can do it independently. Extended services is where the regional center comes back in again. So for voc rehab purposes in our process, once someone is actually employed and they have been working their job for at least 90 days without any type of support, so their job coach has faded away, they are no longer requiring their coach, they're able to work independently, voc rehab is only going to keep that case open for 90 days, and then we're going to be closing it successfully. But in order for that person to at least have a contact in case they get a new manager, maybe they get a promotion and they need to learn new duties, maybe their job is in jeopardy, they have what we call extended services, and that's where there's at least a contact person where they know they can contact, and even the employer knows and can contact if the employer is engaged in that process, so that that person still has support even after their case with voc rehab has been closed. And Desert Regional Center does provide that type of support. And we'll do the next slide. So that was in supported employment kind of in a nutshell. We're going to go and talk about customized employment next. So customized employment is very similar to supported, but it's a lot more detailed process. We at voc rehab, we are actually still receiving training, or in the process of actually getting our contracts together so we can continue to receive the accurate training so that our providers can provide customized employment. So I'm going to just tell you about customized employment. It is an initiative that is nationwide. It's pretty new, with a lot of different voc rehab organizations being trained to provide this service. But at the same time, even though we're not able to do it just now because we want to be certified that our providers and counselors know how to actually provide this service, it's still a very good tool, and we are anxiously awaiting to use it. So I'm going to just go ahead and start the information about customized employment. Next slide. So the U.S. Department of Labor, their definition of customized employment, it's basically saying that it's individualizing the employment relationship between the employee and the employer in a way that it meets the needs of both. So it's identifying an individual's unique skills and abilities and matching that with an employer's needs, so that it's almost really kind of creating a position. It's kind of developed through job carving, or that can be developed through job carving. It can include self-employment, and it also can include entrepreneurial initiatives or other job development strategies that result in customizing a position where you negotiate with the employer to fit the needs of the individuals with a disability. It assumes the provision of reasonable accommodations and supports that are necessary for individuals to perform the functions on the job that are actually also individually negotiated and developed. And next slide. So it utilizes an individualized approach to employment planning and job development. So it's one person at a time, one employer at a time. And then we'll go to the next slide. And that process starts with discovery. So they call it discovery because you're spending a lot more time with that individual, really learning their interests, their skills, their preferences, so that we can make a good match to an employment opportunity. This includes having an actual employment support team. And so that support team can consist of the counselor, the individual, any person in that individual's life who has taken an interest and is really involved in wanting to help that person to obtain employment. It's really a team approach, but it's all because it takes more than just one person to get to know somebody sometimes. So if we can kind of get a team of people that know this individual, we could all put our pieces together and then kind of create a list of, possibilities, and then go out and look into the community on how does this match with an employment opportunity. So that's that discovery process. It's called discovery because we're discovering who that person is. We're discovering unique skills and abilities. We're discovering, how this can relate to an actual job. Okay, we'll go to the next slide. So customized employment is a process-driven concept. The four essential components are discovery, job search planning, job development, and negotiation, and then the post-employment support. The next slide. So in job search planning, during that portion of customized is when you are actually taking all that information that you learned during that discovery process, and you are developing a plan for meaningful employment. So during that discovery process, like I said, it's individualized, and it's really working with that individual. During that process, that person may actually go out and tour or have informational interviews with different places where they think they may have an interest in working, just to be able to make more of an informed choice and decide, is this really something that's going to be a good match? So once all that discovery is done, we put all of those elements together, all the information that was gathered during discovery, and that's when the job search planning happens. So they put it all together into a plan so that they can start determining a list of the potential employers and conduct an analysis of benefits. All right, next slide. Post-employment support. So post-employment support is the monitoring employment relationship to ensure satisfaction of both the individual and the employer. And that's the same, it is the same as the extended services. So post-employment support is just putting into place, making sure that this individual has everything that they need that we can provide to ensure that they're satisfied with their job and the employer is satisfied with their new employee. Next slide. The job development and negotiation. So this is really collaboratively working with that job seeker and employer to negotiate a customized job. So the job developer or that employment team, the job developer is going to get all that information. They're going to go to different employment sites because it's been identified that these skills match this type of work. So that job developer may go into a certain business and just kind of tour that business and see how things are, you know, if there's a need that that employer has that hasn't really been either identified, or it has been identified, but the employer just does not know how to fill that need. And that's where that negotiation comes in. So maybe I can just give an example that I was told before. There was a real estate company years ago, and their employees spent a lot of time just gathering all of their materials together. And that took a lot of time, just gathering the materials on a daily basis, getting things ready to go out. And so a job developer had went to the company and just, you know, talked with the manager or the supervisor or owner and saw what they did and noticed that, you know, there's a lot of time taken being, you know, used to gather and prepare, where if you had someone who was able to do that for you, then your employees could spend more time doing what you're really paying them to do. So that's customizing a job. So that created a job that wasn't there for someone who had those skills and abilities and interests to do that type of work. Okay, next slide.
Vivian?
Yes.
We actually have a question from
Yes.
the chat. Since Forrest retired, actually it's two questions. Since Forrest retired, who's the OM instructor in
I'm
the
sorry.
North? And what strategy do you have in place for the individuals who need that service in order to be successful in the job placement in school?
Okay, I'm sorry. I didn't catch what you said in the very beginning. Can something?
Yeah, what strategy do you have in place for the individuals who need that service in order to be successful in the job placement and school?
Oh, in school?
Correct.
Okay. So in the schools, in the North and the South, the schools are a little bit different. And like I said, for customized employment, we haven't actually rolled that out just yet, but we still can use some of the tools and the ideas of customized employment. I know that in the North and the South, they have a lot of different programs for individuals to get them job ready and introduced into the labor market and introduced into the idea of working. So I guess I'm just not, I think my mindset is not really answering that question accurately.
I will go ahead and email you that question, and hopefully we can get that answered outside of the putting you on the spot.
Okay. Okay, great. Yeah, go ahead. Yeah, email me that, and then I can look at the email too and read it and see if I can get a better understanding.
Allison Greathouse works for you guys as well. She said that they have hired someone for that position, but they started just before the office shut down.
Okay, and which position is that?
I believe she's discussing the orientation mobile instructor. Is that correct, Allison?
Yes, she's asking about the O&M instructor for BSBBI.
Do you happen to know who that is?
I don't recall the person's name, but I do know that somebody has been hired. I can find out the person's name Monday.
Oh, okay. So you're just asking if this is a service that's available for individuals with visual impairment. Is that what you're asking?
She's specifically asking about O&M. She's not asking about customized employment.
Oh, okay. That's what I didn't catch in the beginning. I didn't catch the first part.
I could see you weren't making that connection.
Yeah. I didn't catch the first part of the question. Okay, let me see if I can get to my email and see if have you sent that yet? Okay, let me see if I can. Okay, nope, I didn't see it. Are you going to send that question, Catherine?
Yes, but I can give you the option to research that outside of this if you'd like and get back.
Oh, okay. Okay, great. And was there another question?
No, it was just two questions in one. Who that person was and the what strategies you guys have in place for successful job placement.
Okay. Okay. So I'll just go ahead and continue with the 700-hour program. Is that okay to continue?
Absolutely.
Okay. Okay, and I think that my clicker went before I was clicking. So, so the state of Nevada has a program called the 700-hour program, and it's basically a program to that's helping individuals to kind of reduce barriers for people with disabilities to be able to obtain state employment. It establishes a program for the hiring people with disabilities into the state workforce. And I'll go to the next slide. It is a temporary position, so it's basically something that allows someone to obtain state employment and reducing that barrier and the competition. So this person is able to be hired into a position. So if there's an open position with the state of Nevada and someone has been identified by Bulk Rehab that they actually meet the requirements, I'm sorry, my dog is right here, that they actually meet the requirements of that position and they can perform the duties of that position with or without accommodation, then that person will be given the opportunity to interview. They're put on a list, and it's called the 700-hour list, and they're put on a list for that position whenever there's an opening. And then they are able to actually just show their skills. So for 700 hours, we've had a lot of success with this program, with a lot of people being hired into state employment. So they're able to work for 700 hours. It's like a trial period. If during that period that individual or the employer feels that it's just not a good match and it's not working out, then they can discontinue without any, penalty in a sense, but then, they're not hired. But at the same time, the employer and that individual might find that it's a great match for both, and that person will be hired into permanent state status as a state employee. And that 700 hours will count towards their probation period. Okay, next slide. Okay. So with the 700-hour program, they must be able to perform the essential duties, like I said, of the position with or without accommodation, and it is according to the Nevada revised statutes. And I'll go to the next slide. And then this is their update. So they're originally the language in the law is adding for this particular bill is asking to remove the language that prohibited agencies from using it if the client would benefit from that agency. That has, I don't think that's happened. I'm not sure, Allison, if she can recall or not, but I don't think that has happened. I think that, no, maybe it has happened. There was language in the law that changed recently where anyone that was on the 700-hour list would be automatically hired. And the bill had tried to change that language, but that was not changed. But I do believe that it was changed where now if someone, so for example, if someone is receiving services from welfare and they're on the 700-hour list and welfare wants to hire that person can be hired by welfare now. That language was changed. That person can be hired by welfare. That person may not be able to receive benefits from welfare now, but they can at least be hired, and then the benefits would stop. So that conflict of interest is not there, so that person can become employed. So just going to the next slide. Vivian, so basically, regardless, yes.
We have one question. So what area of vocational rehab is the 700-hour program ran in? Do you have different
So
areas?
It is. No, there is no area. It's all about the individual. So if that individual has the skills and the abilities and can meet the requirements for that job, whatever job it is, then we can put that person on the 700-hour list. but there are some positions that do not qualify or that are not a part of the 700 hour. So I guess the best way that I can answer that is that it's not an actual program that is only for certain positions with the state of Nevada, but there are certain positions that do not use the 700 hour list. That makes sense?
Perfect, thank you.
Mm-hmm. Okay, so just kind of wrapping it up. So basically we're saying, regardless of disability, inclusive employment is the first priority for all working age citizens. And then I just like to use this quote because it's great at the end of the presentation, just saying employment is a way for people with disabilities to give to the community and see what they have to offer. So we're givers, not just takers, and that's from Max Bowers, who is the founder of Self-Advocates Becoming Empowered. And that is the end of my presentation. Any other questions?
As a reminder, class, go ahead and unmute yourself if you have a question or send it through the chat. All right, I see no questions. Vivian, thank you so much for taking your time to be with us today. I know it's a Saturday, so I appreciate you taking that time to be with us. And Allison, is there anything else that you would like to add on the topic of vocational rehab?
I think Vivian did a great job.
Oh, thank you.
Sorry, my mute is hard to get to. So thank you guys so much. I will be sending out Vivian's contact information as well. Just as a reminder, Vivian does sit on our council as well. So she is a great resource for you guys if you have any questions or concerns. If she's not the right person to ask, she will get you to the right person as well.
Hello? Okay.
Oh, can you hear us? We said thank you, Vivian.
Okay, now
Sorry.
I can. Oh, okay.
Sorry
Okay,
about
thank
that.
you. Thank you.
Yes, thank you
Oh,
so
no
much.
problem. Okay, thank you. You guys have a great day.
You too.
Bye-bye. Bye-bye.
Okay, so that was our last presenter for today. We briefly went over the final project discussion, that there is no homework except for you guys need to complete your 5 classes by August and complete your 2030 vision board by July. Dora, we will be connecting with you for our one-on-one as well to explain that 2030 vision board. Is there any questions, concerns, anything else that you guys would like to discuss today? Wonderful. All right. So I'm going to go ahead and I will send out all of the material from today, all those presentations and everything, contact information for all of our presenters. If you guys have questions, you know how to contact me and Carrie, and we're always available via email, and you have my cell phone. Thank you all. Have a great weekend and stay safe.